नोवेल कोरोना वायरस का खतरा बढ़ रहा है, तो हम क्या हाथ पे हाथ धरे बैठे रहेंगे? नहीं, हम हाथों को धोएंगे साबुन से या यूज करेंगे अल्कोहल बेस्ड हैंड रब ताकि नोवेल कोरोना वायरस का खतरा कम हो। WHO भी यही कहता है।
डेटॉल द्वारा जनहित में जारी। डेटॉल इंडियन मेडिकल एसोसिएशन द्वारा प्रमाणित।
Good morning and welcome to the Hand Hygiene Summit, brought to you by the Integrated Health and Wellbeing Council with support from Dettol. I am Kamal Narayan, CEO of ISW Council, India's premier institution for health, awareness, advocacy, and behavior change. While we are all living amid the horrors of ongoing pandemic that is ravaging our nation, in absence of a widely accessible vaccine, what still remains to be the most dependable way to protect us from the virus are masks, social distancing, and hand washing. And today, on the occasion of World Hand Hygiene Day, it becomes all the more important to understand and appreciate the magic of the simple act of hand washing that has always been one of the greatest shields for humanity against many diseases. In the past 1 year, we all have become far more aware of the term hand hygiene than ever before. We all are aware that it is the most effective solution to prevent the spread of COVID-19, a disease that has infected over 20 million people, killed over 2 lakh of them, and affected almost every citizen in India. The insistence on hand washing during the pandemic has brought back the memories of our mothers and sisters insisting on washing hands with soap when we used to come back from schools or play, or before eating a meal. Washing hands with soap has been indispensable, especially after using toilets, as it exposes them to dirt and germs alike. However, the level of hand hygiene could have been highly compromised among many, with factors such as lack of awareness, supply of water, availability of soap, or local habits playing an important role. As the pandemic makes it universally important to wash hands with soap and water for 20 seconds repeatedly throughout the day, inequity in access to enough water and soaps has raised the apprehension of millions of households across the country being unable to protect them from the pandemic effectively. People like us who get water as soon as we open the tap anywhere in our home can struggle to understand why washing hands with soap and water can be so difficult. As per the simple math, one needs nearly 2 liters of water for one round of 20 seconds hand wash with soap, and repeating it 5 times a day will need 10 liters of water per person. While this may sound anything but difficult for most of city dwellers like us, this can come across as extremely burdensome for households that struggle every day to bring a few buckets of water from ponds to rivers to hand pumps in villages, or from public tap to water tankers in cities. And this can be an everyday reality for over 82% of rural and 60% of urban households that do not have piped running water connection, as per the report by NITI Aayog. On top of it, for a poor household struggling just to somehow make the ends meet, for millions who are homeless, having regular supply of soaps or sanitizers too may be counted as unaffordable or a luxury. A recent report records over 50 million people in India may find themselves at greater risk of pandemic due to unavailability of basic hygiene, including hand washing. Lack of awareness or local habits and behaviors too are important factors in poor hand hygiene status for many. The utmost need of hand washing that we all have felt during pandemic must continue to be the part of our life. And for every individual of our society, rich or poor, in cities or villages, as that holds the key of building a really healthy nation that can protect itself from preventable diseases burden that still kill nearly 500,000 children in India. On our first panel of this summit, we will try to understand from the esteemed panelists on how the COVID lessons help mobilize action for ensuring hand hygiene for all during the ongoing pandemic and beyond it, and how mega missions like Swachh Bharat Abhiyan or Jal Jeevan Mission can also help hand washing thrive as a way of life. So let me welcome our esteemed guest for today's summit. We are delighted to have Mr. Jack Sim, the founder of the World Toilet Organization, a groundbreaking initiative that won many awards and accolades globally. Jack is among the most impactful hygiene and sanitation leaders of the world and a source of inspiration for millions. He was named as the hero of the environment by Time magazine in 2008. Jack is also the part of World Economic Forum and Global Agenda Councils for water security and for social entrepreneurship. He is also founder of Singapore-based BOP Hub that facilitates and nurtures businesses that can make impact on the lives of poor and marginalized globally. Welcome, Jack, on this important discussion. We also have with us Urvashi Prasad, the Senior Public Policy Specialist in the Office of Vice Chairman of NITI Aayog, the premier policy think tank of the Indian government. Urvashi has extensive experience in health, nutrition, sanitation, gender, and public policy. She is currently part of the core team supporting the work of the Government of India's Empowered Group for managing COVID-19 pandemic. Urvashi is a member of the task force for overseeing the implementation of sustainable development goals in India. She is also a member of the World Economic Forum's expert network and an alumnus of World Economic Forum's Global Shapers community. Urvashi holds a master's degree from London School of Hygiene and Tropical Medicine. Welcome, Urvashi, for this show. We also have with us Arundati Muralidharan, Manager Policy, WaterAid India. Arundati has vast experience as a public health practitioner and qualitative research with expertise in menstrual health and hygiene management, gender and sanitation, and sexual and reproductive health. She is driven by her interest in understanding and addressing the factors outside of the health sector that have an impact on health and influence health behavior. At WaterAid India, she aims to generate and garner evidence to advocate for the effective integration of WASH into health intervention and for policy initiatives. Welcome, Arundati, in this summit. We also have with us Mr. Ravi Bhatnagar, Director, External Affairs and Partnerships, Asia and Middle East, Reckitt Benckiser. Ravi is a global health communication expert and is known for his penchant for driving purpose in a company and make people act as active social contributors. He is the brain behind several legendary public health awareness campaigns by RB, including the one of kind Dettol Banega Swachh India movement, which has become a global case study in itself for promoting hand washing, hygiene, and cleanliness that yields better health outcomes for all. So thank you all our esteemed guests today on this special discussion. We also have Professor Sanjeev Kumar, who is a speaker in our next session also. So let me begin this important discussion on this important day of hand washing or hand hygiene day, which we celebrate globally. And let me begin this with Jack. Jack, your experience with bringing that toilet movement across the globe and bringing the topic of sanitation, hygiene, sometime which you feel that was not explicitly discussed, especially when it comes to availability of toilets or the habit of going to a toilet for defecation. How that experience can be useful, or what learnings you would like to share from there which can be utilized for enhancing the hand washing practices in India as well as many other parts of the world. And also especially when people have realized that hand washing is not just a hygiene practice, but it is something very, very critical practice to keep people safe from diseases or save lives. Jack.
Thank you very much. I want to share two experiences. One is when I was growing up as a child in Singapore, while we are still a British colony. 1957, I was born, so around 1960s, we were still having no proper sanitation. We have a bucket system, and hygiene, hand washing was almost missing. Soap is expensive, and so we have all this problem. And eventually, we have typhoid fever, cholera, diarrhea, intestinal worms. We grew up that way. But public housing eventually became available to everybody, and we have flush toilet, and immediately the country progressed economically because sick people are not productive people. But with the flush toilet and the hygiene and water supply, immediately the country turned over about 25 years from a third world to a first world country, and today is the fourth highest income per capita in the world. So I think that the lesson to learn is that India can be very, very productive if they don't have this big amount of morbidity and mortality. And that is a high cost, that hand washing is much cheaper than the illness, loss of productive days, and death. The second experience I want to share is that while we are all so aware about hygiene, I'm worried that once this COVID is over, everybody will forget about this. Because in 2003, when we had the SARS crisis, which only affected Asian countries like Taiwan and Singapore and Thailand and Malaysia, the SARS was a small-scale problem like COVID. And everybody was very, very conscious about hand washing. And we were all taking care of each other, making sure that we don't pass pathogens to one another. However, that disease disappeared after 1 year. And sadly, the hand washing habit did not continue. And so this time, I think we have to be very, very aware that a bad thing can be used to indoctrinate this permanently, that even in peacetime, even when there is no pandemic, hand washing is still a very critical thing to maintain the economic well-being, the social well-being, and the health of the people. And so I hope that our Indian government can make policy to put this into school books, into children book as early as possible. And I was already discussing with some publisher how to create a Mr. Toilet learn from Mr. Toilet book, so that we can create this book not just in India, but in all the countries, that young children from first day in school will learn about how to keep yourself clean, personal hygiene from Mr. Toilet avatar. I hope we can work with NITI IO on such a project. And with Ravi on Reckitt.
Thank you so much, Jack. Very important statement that sick people cannot be productive people. And if we want to make a nation we have a higher productivity, have a better well-being, social, national, family, individual, we have to ensure that all those interventions which are important to keep healthy people healthy are followed. Let me come to Urvashi now. Urvashi, NITI Aayog has been very, I think, actively working on this space, and the Prime Minister has also, kind of pushed a lot that Swachh Bharat agenda. We are, we have made a very remarkable, progress in terms of kind of discouraging open defecation, or maybe, reaching to the level of open defecation free country. Certainly all that also embed the message of hygiene and sanitation, and hand hygiene definitely comes into that as well. But keeping in mind that what we have seen under Swachh Bharat mission also, that while the toilets have been created, the maintenance of the toilets, or maybe their upkeep is not done that way, which is in a way discouraging the usage of toilet. And at the same time, when we are not kind of using toilet, the practice or habit of having a regular hand wash may also get diluted. And as we see in the NSS survey also, hardly 38% of Indians using soap to wash their hands. And I have also highlighted a couple of figures which says that the overall availability of water itself is a big issue. These are the big systemic problems. There is one thing depend on other. How do you see this whole issue in a holistic manner, and where do you see that how we can break it into an actionable agenda which help us achieve higher number of compliance towards something like hand washing?
Yeah, thank you, Kamalji. I think first of all, I'm very happy to see Jack here. We are sort of reconnecting virtually after a long time, but whatever gaps have been there, I've continued to follow his work and admire his work. I think of course, I resonate with everything that he said, and your question also rightly, when we look at it in the policy perspective and the policy lens. There's a hardware part to it, there's a software part to it. Now, on the hardware side, as you said, the toilets, the infrastructure itself, the access to running, drinking water, access to soaps, by no means is that challenge over, not at all. And I think that is something that we all are very clear and have to be very clear about, because we are a country with tremendous diversity, with tremendous inequity to begin with. So even those fundamental parts of the infrastructure, the hardware, we have a long way to go still. And we have to keep working on it to, first of all, get people access to that. And then secondly, ensure that there is a regular maintenance system in place for that. Because, we've often commissioned these surveys where we find that, okay, in the first year of the toilet being there, there's a high level of functionality, there's a high level of usage. And then as we go to year 2, 3, 4, consistently that starts falling off. So that is something that, of course, has to be a big policy priority. But the other part, which I think has not been addressed sufficiently right now, and that's perhaps because we are trying to, get from one thing to the other, and, we are starting with such a low base and with so many challenges and such a large country, that's perhaps why that's happened, is the whole behavior change aspect. Because ultimately, a lot depends on people's behaviors. I've worked in urban slums for many, many years. And it's very evident that, people, once they realize and truly appreciate the need for something the value of something, it is aspirational for them, they actually often come up with a lot of very good solutions themselves. It's not always about government sitting and saying, I know what's best for you. Actually, people can themselves often come up with very good localized solutions, bearing in mind the resource shortages, other issues, once they are themselves convinced that this is something we absolutely must have, or this is something we do want. So that element of making sure that it's a felt need by people themselves, bringing about that behavior change, focusing on aspects of hand hygiene, or whether it's menstrual hygiene, that's not what we are discussing today, but again, a very crucial aspect of the whole hygiene issue that we're talking about, which has so far not been adequately addressed. So absolutely, as Jack said, we need to start early, we need to start with children, we need to start in schools, but we need to do these very intensive and sustained behavior change. Otherwise, what happens is you will see behavior change for a short period of time, and then it starts to fall apart. We've seen that with masking as well, even in the middle of the pandemic, that we started off with fairly high rates after a few months, and then it just dropped off. People went back to business as usual. So it's not just about doing one or two large campaigns. It has to be a sustained, localized effort through multiple channels. And at least on our part, that's the kind of emphasis we're trying to bring into the policy making space.
Thank you so much, Urvashi. Your 2 points. One is important about the behavioral change and how we have to ensure that the sustained behavior change is achieved, and what it is going to take. I'll ask Ravi on that. But before that, let me just bring in Arundati also and try to understand that what is the the scenario we see. What is her experience about the access for enough sanitation tools with both, in terms of hardware or software, as you mentioned, in our society, and what are the ways to actually overcome on it. And then I'll come to Ravi about the behavioral change aspect and how much it is important and how much it is what it takes to ensure that the sustainability of it is maintained. So Arundati, your experience from the WaterAid side, and you have been very focused working on sanitation, hygiene, menstrual hygiene, as well as Urvashi mentioned. What is your view on India's access towards having enough sanitation and hygiene infrastructure which can have easy access for hand washing or can facilitate it?
Thank you so much, Kamalji, and thank you to Himani for having me. It's a pleasure to be with these panelists. So, Kamalji, just to go back to, you had started saying that you had highlighted a couple of really critical things on hand hygiene when you started the conversation. One, that you had said that it is a, what's stopping us from engaging in this really simple behavior. The second is that you also alluded to this thing that the behavior has dropped down. So we practiced it early on in the pandemic and something happened. And I think this is very important for us to unpack. So if I look at what we've learned on hand washing just in the past year, some really stark things come to mind. One is that we haven't made, as Urvashi has alluded, we haven't made adequate investments for hygiene, and hand hygiene being a critical component. We haven't made enough investments if we're looking at the household level. We have made some investments when we look at schools. I think under Swachh Bharat mission, we've seen a lot of attention that has gone not just to toilets in schools, but also to make sure that hygiene infrastructure as well as water facilities exist there. But when we're looking at community settings and other settings, worksite settings, public spaces, there's a lot that we need to do to make those investments for the hardware as well as two aspects of software. I'd like to split that into, one is the awareness component, which I think that is essential. And then we look at digging deeper into how do we inculcate this into a sustained habit or a practice that people will continue. It's also important to realize that I think that all hygiene behaviors related to COVID, whether it's mask use, hand hygiene, and some other behaviors, were very fear-driven. And for those of us who worked in behavioral science, we know that fear is an immediate motivator. Emergencies are immediate motivators. They are not long-term motivators. And I think we need to start making this shift in our minds that using fear as a motivator can be done for only limited periods of time, and that we really have to shift gears if we're looking at making people realize the personal importance of these behaviors and make hand hygiene and other hygiene behaviors a social norm, as those of us working behaviors will say. I think we've also learned that it's important to push hand hygiene, but hand hygiene cannot be pushed in isolation. What we're learning is it needs to be a part of a suite of behaviors or a group of protective behavior. So, for example, if we go back to sanitation, we need to link hand hygiene with use of toilets. If we're talking to health programs, to mothers, adolescents, and others, then we need to be able to link hand hygiene with other health aspects. So it needs to be a part of a larger suite. If we're looking at COVID, again, hand hygiene needs to be in conjunction with consistent and correct mask use, social physical distancing, avoiding crowded spaces, early detection of symptoms, etc. So we need to be looking at it as holistic. It's a part and a very critical part of a bunch of behaviors that we need to be promoting. Making this link also helps individuals and communities adopt the behavior. There's also, I think, some things that we need to do in terms of changing our messaging on hand hygiene. What we've learned in WaterAid and conversations with a number of sector actors, civil society organizations working on hygiene and wash is we've approached it from a very awareness perspective. But we need to go beyond this to say that what's going to make hygiene a personal relevance. How does hand hygiene really protect me? And how does me engaging in this behavior protect my children, protect my community? I think extending it from beyond wash your hands with soap and wash your hands at these times to how is this really protective and how can it really benefit me in the long run? We also have to remember, like, unlike toilet use, hand hygiene, the benefits to us are not always immediately tangible. A child may not be suffering from diarrhea. None of our family members may be affected with COVID. So there's a perception that my risk is lower. We need to figure out how to kind of jump this mindset barrier that exists in many of us. I just highlight a couple of more things that we think that where we need to be tackling hand hygiene. And this is a part of work that we're doing with UNICEF, WHO, IRC, and others looking at the hand hygiene for all global guidance. Is hand hygiene is not the prerogative or the responsibility of one sector or one ministry. It is something that is relevant to health, to nutrition, to education, to wash, sanitation, water, rural development, urban development. And what I think that we've spent a lot of our time in the past few years is to push a single ministry, push a single sector to take ownership, to push this agenda. We need to go beyond this. We need to say that the health sector, government and non-government, has a responsibility and has a mandate to integrate hand hygiene and other hygiene behaviors into their work. So does nutrition, so does education, so does urban rural development, and so do sectors working on WASH. So we need to start making this mindset change, both for those of us not in government and those of us in government and working with government. So I'd like to end with this last point. Thank you.
Thank you so much, Arundati. And you are trying to give a very holistic picture in that how we need to, ensure that hand hygiene is taken in a totality, not as a, a separate, practice. Ravi, changing the mindset is one thing which is very important aspect. And as Arundhati also said, you can't force somebody to keep following the hand washing practice. It becomes like, as I mentioned, that when we used to come from schools or after playing, and our mothers or somebody in the family used to say that go and hand wash with soap. Many times we didn't feel that, okay, there is a need for washing hand with the soap, or maybe we washed our hand with just water. And I think almost 57% people in urban settings today also wash their hand just with water. Or if those who are washing hands with soaps, we don't know what kind of soaps they are washing. And the one thing which was a revelation for all of us was washing hands for 20 seconds. 20 seconds that was completely missing earlier. We might have washed hand just for 5 seconds or maybe something like this. So what I'm saying that this practice has to be adopted or followed by everyone, and it has to come from within. Because since as Arundati says, that the outcome may not be immediate, how do we drive this kind of behavioral change, which cannot be sustained just by fear of, let's say, a pandemic? Because we saw a pandemic fear and we also let our guard down and we quickly get into the bigger mess. So this is something which is not as kind of fear oriented in terms of communication. What has been your experience under through various activities or initiative which you did under Dettol, and what is the best way you see that we can get this mindset changed?
First of all, thank you, Kamalji, for having me here again. On the with the ISW. We're very thankful to you for giving us space and opportunity to talk on this very important day and subject, which is very core to our hearts and which drives our purpose of the company, to giving the last mile access. And I was hearing Jack, Sim, Urvashi, Arundati, and it's amazing, their point of view. And personally, I have opportunity to work with Jack, Sim from last 5 years or so in India, in Australia, and in the other parts of the world where Jack and me are working very closely. One thing is very important, but Urvashi has told, and what Arundati has also mentioned, and you are also seconding that. Hand washing and just soap, that's fine. That should be propagated. That's amazing. But it's beyond that, So looking into that, Dettol has a 360-degree approach where we talk about hygiene at home, hygiene in neighborhood, personal hygiene during illness, and the various behavioral nudges that we use. And we're very proud, we did during the first COVID wave last year, we reached out to around 125 billion people across the world through our TikTok campaign, which started from India. And, if you put numbers of many big corporations and the corporates, even that our campaign, is still bigger than if you are putting 2 or 3 major giants. In India alone, it's a major and the biggest single campaign which ever happened. Through our on-ground work, sustainability and sustaining is a very important thing. We started parallelly with the Swachh Bharat Mission announcement when Prime Minister Modi announced it. And he was the one actually who announced our hygiene kits for India, which have gone to around 650,000 schools and 5 lakh gurukuls and madrasas across India. So total footprint in India is around 20 million school kids are being covered by our program in India alone. And the similar program is there in Bangladesh. Similar is in, Nigeria, in South Africa, Brazil, and many other countries. Dr. Kalam and us, we co-created the whole, the games, and we use the STEM learning approach for making sure there is a scientific rigor to the hygiene education and make sure germs feature in the children's life somewhere, and the importance of germs and how they should get rid of germs, because these germs are not visible. There was a major thing, what one of the speakers actually told, children are not able to see the direct correlation between these germs and their lives, because diarrhea may not happen, COVID may not come to their families, etc., etc. So through the STEM learning approaches and through the behavioral nudges, a lot of work is being done with Dr. Kalam when he was alive and with the other institutes in India. The recent one is with the, Byju's and the Whitehead Junior, where there are a million kids actually doing the coding on hygiene. And they will be awarded on hygiene. And that's the first in the world ever done by any company. Because children are at home, they want to be engaged. So why not to do something which is a nation building? And amid COVID, that is one of the biggest things what anyone can do, where you trigger children so that, children need assistance from their parents and parents talk to each other. Now there are, Gurgaon moms and other moms networks where moms talk about the overall development and the well-being of the kids. And hand hygiene, if that takes a place through our coding work also on hygiene, that's a new trigger which is started. When we go to the Bharat, which is not actually India, and there is a still big divide, so there are big things which are happening in, places like in Bihar, I will give you in Madhubani, in Darbhanga and other places, there are Madhubani paintings, and through the Madhubani paintings and the artists, how you are giving the messages on the SMS, which is the Government of India's campaign on the social distancing, hand washing and, the mask, wearing the mask. So how you are actually using the behavioral nudges by using the folk art, the culture, the dance, or the jathas from Orissa or the jathas from West Bengal. So how you are leveraging the local culture, art, and tradition to give the culturally adaptive, messaging, rather than something which is just on the TV, which will not reach to the media dark areas. We are seeing it as a huge success. There are a lot of questions people do ask us. Okay, are you inclusive? So what is Detol doing for the blind? Yes, we have the curriculum in Braille, which goes to around 100 plus schools, which are all blind schools. We have the audiobooks for the kids who can actually just listen to this, and we have various and then one thing which this government has done very beautifully is actually introducing the Swachh Vidyalaya Puruskar. I'm very proud to say, there are 300 plus schools in last 1 year, who have got the Swachh Vidyalaya Puruskar. But it's not just us; it's a community participation. It's a people's program. It's a social program, and brands do have a role to play. Development sector too have a role to play. But the biggest role, what we are saying, is of the kids. When I see the children parliaments, which are 50,000 in existence now, which are supported by us in various states. So 50,000 children parliaments are there, which are actually asking questions in the SMC meetings, which is the PTMs, in the parent teacher meetings, and to the school management committee, why the school toilets are locked, why only teachers' toilets are open, why the girls' toilets are locked, where are our menstrual pads, where is the soap. So when you see children taking the charge and challenging the status quo, that is something, the role of the corporates is also somewhere lying there,
Yeah.
Next thing is making things fun. We know, in Bharat, there are plenty of kids who are from the last quintile. What are we doing for the last quintile work? This, I will appreciate the work of, Jackson, and he actually, showed us the way through his BOP hub and his work across the globe. You need to have the last mile access also available. So now there are birthday parties, there are anniversaries, there are school festivals where the children who are more well off, there is a donation box, and it's not the money donation. There are soap donation boxes which are there. There are sanitizer donation boxes which are there in the schools, and this is one of the ways to bring, if not equality, at least equity, so that the kids who are haves can actually help have-nots. And sharing is caring, and working on the basic fundamentals of child psychology, of neuro-linguistic programming, which is also called NLP. There are certain kids who love touching the things and they learn it. There are certain kids who listen to the stories. There are certain kids who are more in the art, drama, sketching, drawing. So you use various medium and media to reach out to the kids, and you work on the behavioral nudges. Last but not the least, people do ask us, how is the pudding? So the proof of the pudding is in the social return on the investment. So what 1 rupee spend is giving on your programs. I'm very proud to tell you, Kamal, my programs on the hand hygiene, which I reached to around 20 million school kids in India, it gives me return of investment of 1:34, which is pretty high. And when I go to the religious schools like Madrasas and the Gurukuls, it further increases to 1:49. That's best in class. But that is not the power of Detol. It is because it has been possible because of the SDG 17, which made us think about the spirit of partnerships, the spirit of working together and getting the right kind of partners like you, like many others, and bringing the difference between the have and have-nots. Thank you. This is my submission, Kamal.
Ravi, really a commendable work. Reaching out to 20 million children is definitely a very, I think, a massive intervention which has been made by your organization. Children are definitely one important aspect of driving the overall behavioral change, and I think having more sustained outcome from it. But at the same time, we also need to be mindful about the massive the segment of our population, which includes people from all age, and those who also don't have the access to all that which is needed for following something as basic as hand washing and other hygiene practices as well. And at the same time, they are also not made aware enough or nudged enough to follow a certain hygiene practice. let me go to Urvashi again, and I'll then come to Jackson, because I think a lot of work which Ravi highlighted, Jack can put a little bit more light on it. But before that, Urvashi, keeping in mind that how you talked about the software and the hardware part of it, and I think under one thing which is Swachh Bharat scheme of the government, the Swachh Bharat mission, we saw both of that very I think forcefully or maybe impactfully driven, both in terms of the hardware as well as the software part of it. The same was, we also saw, and here I'm talking about the behavioral change communication, and at the same time keeping it impactful also. The same kind of push we also saw during the pandemic, where the government could make a very, very direct communication with the people, highlighted the need of these basic practices of hand washing, masking, and social distancing, which also got diluted over the period. And not only from the public, because we have been discussing in many of our sessions that public, kind of let their guards down. But at the same time, I think the communication also got overall diluted, that people started getting a kind of overall feeling of complacency or a victory over COVID-19, which made them let their guards down. What you see that can be actually followed to ensure that something so simple like hand washing, which is definitely a part of multiple other activities also. It cannot be alone. It cannot be, that you go for a open defecation and hand wash, with soap, and you're done with your, responsibility. So as Arundati said, that it has to change the overall, behavior of the people and make it more hygiene oriented. As Ravi said, that the hygiene of the family, hygiene of the neighborhood, hygiene of the, personal hygiene and everything. How government can drive this, aspect by ensuring that people do get what they need in terms of following this practice? Can there be a regular, we saw those, water tankers going to the communities for hand wash during pandemic. A lot of photo op also was created by different, communities, governments and all. Can it be a regular practice, or what should we follow, that everyone who does not have the access to the water and the soap can get it, and it is driven for let's say a year or 3 or 2 year or 3 year, that it becomes the part of their overall lifestyle?
Yeah, so Kamalji, 2 points I'll make, and they link up actually with a lot of what Arundati was saying, also what Ravi was saying. So I think it needs to be addressed, at a broader holistic policy and government level. Then these more minute micro level solutions can always be found. Now, the first thing is, it's actually not just children or communities. It's incredibly difficult even sometimes to make people sitting in the highest decision-making positions to understand the link between these types of interventions and the massive returns you get in terms of preventing disease, in terms of promoting productivity, because, a hospital is very visible. When somebody falls sick, they go to a hospital, they get treated. It's very visible. Now, much of public health, the way it is, its success is when there is nothing visible. You have probably succeeded in public health when you have nothing visible to show. You have nothing tangible to show, because you've actually prevented disease, you've prevented illness, you have allowed people to continue their way of life, their productivity. So that is incredibly difficult to make that link, even at the highest levels. It's not just the communities or the children or the people who sometimes, you have to make this link, but incredibly so even in the policy space. It's often not that apparent, and so we have to actually keep reinforcing and repeating that, if I'm doing this and I'm actually preventing disease, that's a very tangible outcome. And that's perhaps much more tangible than building a hospital and, treating somebody there. So that's one part of it. The other is over medicalization of health and the way we look at health. Because public health, by its very nature, is interdisciplinary. Public health would have people who are social scientists, people who are behavioral experts, like Ravi was saying, the interventions you need in public health. If you want to promote hygiene, you need the mothers groups, you need social media videos. Now, that's not a medical doctor's job or a specialist job. A medical doctor can, yes, tell you, you must wash your hands, otherwise you will fall sick. But it's not their job to get that message out to every household, every school, every child, every mother. That is a public health expertise. And that is why we've been pushing a lot for this separate public health order. Some states have shown some traction. Some states already have it, of course. But we are continuing to push, even though, as I said, the response is often less than enthusiastic, because, you know, the response towards medicalized interventions is always much more. Public health sometimes not as much. But we have to continue pushing in this direction, because that's the only way to change things. People have to realize that public health is nutrition, is gender, is education, is water, sanitation, environment. It's everything. It's not just a doctor or a specialist sitting there and treating somebody. So I think those are two broader points. And if we can address, I know these are really difficult to address, and I myself, working in public health all these years, get very frustrated often with these, but we have to continue to push. There's no other way. You know, we cannot afford to just accept it how it is. So we have to continue pushing these messages through whatever channels are available to us, and hope that eventually this message will sink in. That you cannot continue to approach this whole problem from a purely medical perspective. So I think those are the two broader points I wanted to make, and they link up a lot with what the other panelists are saying. Yeah.
Urvashi, so just a supplementary question in a way. You said that prevention is something which gets a very unenthusiastic response from the governments or the authorities. And you are saying, you know, while sitting at NITI Aayog also. So I think that makes a lot of, you know, it's a big statement in a manner. So do you think that post this pandemic, where we have seen that, you know, if we are not driving the prevention, we are not working towards prevention, the cost can be massive. It is not about just getting the social, you know, outcome, or let's say, for example, return on social investment. This can be a disastrous outcome on lives, on the nation. Do you think that the same authorities, the same state governments, or for that matter, the same central government, will be more receptive for prevention post this pandemic?
Yeah, I mean, I certainly hope so, because this has been a very, very big event. But as Jack said, you know, sometimes I worry that we forget about this a few months down the line. I certainly hope we don't. And at least whatever efforts I can make in my capacity, a lot of the higher level decisions are made well above my pay grade. So I don't make all of those. But whatever I can do to influence in my capacity as a public health person sitting in the system right now, as you said, and I think we all have to continue to do that, because it's true that I wouldn't say that nothing has happened or there's been no change. I also don't want to sound completely cynical, but it's not enough, and there's a big challenge. So we have to continue to put out these messages. We have to continue, even if we get a few states in the beginning who show some interest, we have to push ahead. You know, the whole country might not immediately change, and I don't think it will. Of course, we are a very large country, very diverse, lot of issues. But even if we see some traction with some, you know, states or some people, even in the central government ministries, we have to keep pushing forward all those channels, because that's really our best hope. We do have a very big crisis right now. And yes, we have to do our best to try and convert this into a longer term opportunity for us to try and bring about some of these crucial systemic changes.
Thank you so much. I think that's quite assuring that you see a much, I think, solid hope of this being or becoming at the center of the agenda for many going forward. Jack, you know, you have been driving this whole communication, the movement, and as you said that you know, there was some time you don't feel the need of something, and this is need to be, you know, kind of ensured, because this is really important for the prevention of things which we, you know, ignore. We do see millions of deaths happening across the world. In our own country, we have almost 500,000 children dying of diarrheal diseases and all. These are the big numbers. These are not small numbers. If we see, the pandemic has killed just 2 lakh people. And we have these kind of pandemics going on every year, or more than that. but we don't look at those numbers and we don't see the immediate outcome of that. So it is the, public may be forgetful sometime, but it also becomes the responsibility of authorities, and which you have been driving across the world. You have ensured that the United Nations take up the resolution of making the World Toilet Day. This is something which is a big steps towards prevention. How do you see that, and what are the nudge we should have to make our authorities become more, receptive, which, Urvashi said that sometimes the response is not that enthusiastic. How the authorities can be more receptive, and at the same time, how we can make the public also to buy that. You are on mute, Jack.
Thank you very much. I think Urvashi make a very, very valid point, because doctors are curative people and not preventive people. And what she's saying is that what counts cannot be counted, right? What counts cannot be counted. And this is the problem. So what we need to do is now to create a situation using data, using storytelling narrative to convert preventive health into predictive health into visible health. So if you take these 3 steps, so you can say, I'm doing preventive health, and they say, yeah, nothing happened. What have you been doing? Are you just drinking coffee every day? So we can say, if we didn't do it, then this will happen. So we have to quantify it, right? And then we have to make it visible that this is real work done. Now I'll give you an example. Every year, 2 million people die of diarrhea. There is no shutdown of the world. There is no declaration of pandemic. Why? Because 2 million people are not high-income people. They are like ignored people. This is totally inhumane. And when 30,000 people died of COVID, the world shut down. 30,000. And then now it's, of course, more than 2 million people died. But that is how unfair the world is, looking at one human being not as the same as another human being. I think we have to address that, and we have to change this kind, because COVID has told us that nobody is safe unless all of us are safe. Now, can you imagine Singapore has been managing the COVID crisis very well, and now yesterday we have a announcement that we have to have more restriction because the construction worker from India are now bringing back this new strain. And everyone is connected to everybody. So we have to take care of India. We have to send oxygen tank and everything. Everybody should help everybody. And if there's one thing that COVID has started to teach us, is that there is no borders. There is only one humanity. And if you begin to understand that, I see it as an early warning towards the bigger one that's bigger than COVID. Is called climate change. And that one is going to wipe out even more people. So if we start to think not as countries, but as one world, I think the mindset will change. There's one more small point, very small point I want to add, is that while we are talking about hand washing, we should create a nail clipper campaign. Because if you don't cut your fingernails often, the hand washing cannot wash that part that is inside. And then when you start to cook or eat, then there's a problem. So a clipper costs maybe 10 cents to 20 cents. And corporates can put their logo on it and it lasts for years. And I think that the investment in nail clipper is very, very critical for part of this hand washing. Because when I go to the villages, I saw the people cutting their fingernails in the most bizarre way. They take a knife to slice their nails, and then they bite it. So all these are wrong way. So let's also do a nail clipper campaign. Yeah, thank you.
And thank you so much, Jack, for bringing this point also. I think nail hygiene is extremely critical for the overall discourse of hand hygiene, because many times we forget. And as I said, that even the 20-second funda was also not very clear to us, and many of us were washing our hands, but not the way it should be. Let me just have a very quick remarks, last remark from Arundati and as well as Ravi. Arundati, my again point is, and which is also the focus of this session. We are in the middle of once in a lifetime, or maybe once in a many lifetime opportunity of being in the pandemic, where people have seen that if you do not prevent, you get into a big mess, which can be extremely disastrous. Jack is mentioning also about the climate change, another looming disaster, which many of us tend to not to look at it. Do you think that the efforts, the mission of many of these public health champions like Ravi, like Urvashi, like you, like Jack, has an opportunity to drive the unprecedented outcome, as we see both people and authorities more inclined towards buying the agenda of preventive health, which should be a predictable health, and also as a the measured outcome, as well as Jack highlighted. What is your point, Arundati, on it?
Commenting very quickly, I think that we are at a very critical turning point. We do have this window. The second wave has many reasons why it has happened, but one of it is that we do need to focus more on preventative aspects, health promotion, disease prevention. Our entire, I think, much of our history of working on health systems has been from a treatment perspective. This gives us an opportunity to kind of push the agenda. We're looking at the health for all, one health agenda. This is the opportunity to talk about the importance of health promotion, of disease prevention, and make sure that our health initiatives that are focusing on neonates, children, women, adolescents, non-communicable diseases, chronic diseases, brings in the prevention angle very strongly, and that hygiene is a component of it. We also have to push this from our nutrition sector as well as other sectors. So we are at a critical turning point. Now, if today or tomorrow or the next 1 week is the ideal time for us to push this, I think that's a bit hard. Right now, our health systems are grappling with the provision of essential treatment, of essential care, right? So that work does need to continue. However, there are wings of government and a huge civil society and a private sector where our expertise is not on treatment. We're not medical professionals. We may be public health professionals and development professionals. What can we do to catalyze those actions on disease prevention, on health promotion, on the ground and at various levels? And even levels that inform policy, donor decision making, funding allocations, etc. I think we have a huge body of actors, of stakeholders who can be working on the prevention model. And we need to do that now. In fact, later today, we do have a panel that's looking at CSO engagement on COVID appropriate or protective behaviors and how we can really push this. So government, especially the health, Ministry of Health, is quite overburdened looking at treatment, and we must let them do their job. But look at the wings within the Ministry of Health that can push this. Look at all the other government departments that we have that do have an opportunity to do this. And let's engage private sector. Let's band together CSOs. Let's share what's working well. Let's share our IEC resources more widely. I think NITI Aayog is already doing that, So let's see how we can do this to catalyze this.
Thank you. Thank you so much, Arundati. We need to do it together. And I think you are highlighting that it's in a very, very important turning point we are at. Immediately, I think the whole system may be, in a firefighting mode, but we, at least the public health cadre, which is, which can be put together maybe much faster than before should work on this side. Ravi, just a quick intervention, and I will be ending this session because all our other speakers for the next session are with us, and we are running maybe slightly late, but not much. We can wrap it up. Ravi, what do you think that in a situation where you have shown a big body of work, such a massive reach out to the children, now we need to take it to the next step, and this is the best time or the high time we take it to the next step. How do you see organizations like Dettol or Reckitt Benckiser now working in more partnership with maybe NITI, Aayog or other, or maybe do you think that there is a need of a very, very dedicated kind of system, maybe a new ministry for disease prevention, where we
very interesting question, Kamal. Very interesting.
So something like this, because if our present ministry is overwhelmed with the firefighting mode, shouldn't we have a very, very dedicated structure which focus only on prevention, which helps achieving the social returns, which you have been highlighting all along?
I have two perspectives on this. One is like Urvashi is here, so we need a big cadre of people like Urvashi. I remember my days when I was with the World Bank and was a health system development expert for Gujarat and Maharashtra. I remember those good days when Government of India was trying to take care of AIDS control program, and there was an inter-ministerial group where from the Ministry of Tribal Development to Ministry of Labor with the ILO, with Ministry of Transportation and Shipping, like in the Alang ship breaking yard. So a lot of ministries were involved, and there was a common behavior change communication toolkit which was given, and there was a active resource allocation done so that everyone has to play a role. So that is one thing, because it's not just the Ministry of Health's role, Second is Urvashi has said something which is very, very important in today's context. There are three frameworks. One is the prevent framework, second is promote framework, and third is the treat framework. Under the pandemics, I have responded to Ebola. I have responded, I have done a lot of work on MARS and SARS, and now, COVID-19. So my experience is like, it's very, very interesting to invest significantly on the pre-preventive healthcare. There is a preventive healthcare, but before that, there is a pre-preventive healthcare. If India, and there needs to be a use case in India on the pre-preventive healthcare, and Dettol will be championing this and will be investing significantly on the pre-preventive healthcare. So you see the COVID appropriate behaviors. If pre-preventive healthcare was invested significantly and was done in a very robust way, then we could have seen less of the COVID idiots. Sorry, I am very blunt. There's a huge population who are the COVID idiots also. These were the guys who were aware. Government put the investment in telling them. Behavior change communication, our competitors from ITC to Unilever to Dettol to many others were all talking about sanitizing the hands. Government was also talking. Swachh Bharat Mission is also talking. See the Swachh Bharat Gramin side, they were also talking. IHW, you guys also had a lot of conferences and everything where you were talking about all these things. What happened? Why it didn't work? People thought it is a short-term phenomena. In India, India is a country of NCDs. NCDs largely are the non-communicable disease. There are 5 groups which will be super impacted by this COVID-19 alone. One group is, you have people with a heart disease. India is a diabetic capital in the world. Third is a cancer. Fourth is asthma and other respiratory disease. And fifth is basically, your high blood pressure. So if India is the NCD hub, then, to all these target groups, it becomes more important to tell about, SMS campaign of Government of India, which is social mobilization, hand washing, and, social distancing. Because these guys have already existing mortalities, and pre-preventive healthcare has a very big role to play so that people are aware, behavioral nudges are used, And our promise today on the show, what we are doing with you, our promise is to reach out to 10 million new moms on the pre-preventive healthcare. We are going to reach out to 50 million kids and the families on the pre-preventive healthcare. And we will be working in the state of Uttar Pradesh, where we will be, the state is equivalent to where our headquarters is based, which is in the UK. The population is same. We want to work there, and this is our commitment. This year we are going to work there in a very big way. And everyone has a role to play. You also has a role to play. NITI Aayog also has a role to play. And then we have a lot of friends like Jack, who keeps us challenging and telling us preventive is not enough. Think about the pre-preventive healthcare. Think about the behavioral nudges so that India, the gap between Bharat and India can be, bridged down, and we become a country which is more robust. Thank you so much.
Thank you so much, Ravi, for, kind of underlining the need of not only preventive, but also the pre-preventive healthcare, which can actually help us, mitigate the risks like a pandemic, and also can help us, the resultant damage, which can happen in a country like ours, which is, also the NCD capital of the world for many types of NCDs. Here we come to the end of this session, and I think the one message comes out very, very strongly, that preventive health habits, be it hand hygiene or personal hygiene or hand washing with water and soap, is not something which is only useful at this time of pandemic to prevent an infection of a deadly virus. This is something which can help people stay healthy, stay productive, have a better performance in school for children, having a happier, healthier family around you, neighborhood around you, if you follow these practices. So this particular message has to come very loud and clear from this session, that pandemic or no pandemic, the hand washing practices must continue, along with many other hygienic practices which we must follow to ensure that we are able to prevent diseases. And we means the public as well as the authorities and the government, everyone who is part of this society. So thank you so much, all our esteemed speakers who spared their time for this a very special program. The next session is very interesting, because there we are going to hear from the doctors that how just by not following the simple practice of hand washing can lead us to many diseases. And you mentioned, Ravi, about reaching out to 10 million new moms. We have a very senior gynecologist and also the women health champion in the next panel, who will be also, I'm sure, highlighting this. So with this, I end this session and hand over to my colleague Anisa Nair Dhawan to take the next session forward. And before that, we will have a small break to have a audio-visual message from Dettol. Thank you so much, all our speakers of this session, and welcome all speakers for the next session for this very important summit on hand hygiene. Thank you so much.
नोवेल कोरोना वायरस का खतरा बढ़ रहा है, तो हम क्या हाथ पे हाथ धरे बैठे रहेंगे? नहीं, हम हाथों को धोएंगे साबुन से या यूज करेंगे अल्कोहल बेस्ड हैंड रब, ताकि नोवेल कोरोना वायरस का खतरा कम हो। WHO भी यही कहता है।
डेटॉल द्वारा जनहित में जारी। डेटॉल इंडियन मेडिकल एसोसिएशन द्वारा प्रमाणित।
Thank you, Kamal. And indeed, something as simple as washing your hands thoroughly with soap and water can actually protect you from many killer diseases. This is something our speakers have highlighted in our first session. And of course, we're going to continue this discussion further. Now, hand washing is a life-saving practice when it comes to preventing infectious diseases caused due to poor hygiene practices. Now, India carries a heavy burden of infectious diseases, which lead to death of nearly 500,000 children in India. Now, COVID-19 has shifted the attention to this very basic practice towards controlling the spread of infectious diseases within the community. Now, please welcome community medicine experts and specialty doctors who are now joining me on this panel discussion to talk about the ground situation and the challenges they face when it comes to this something so simple as washing hands. Please welcome Dr. Jugal Kishore, Director, Professor and Head of Department, Community Medicine, Vardhman Mahavir Medical College and Safdarjung Hospital. Please also welcome Dr. Govind Makharia, Professor, Department of Gastroenterology, AIIMS, and Honorary Secretary, Indian Society of Gastroenterology. We are very privileged to have Dr. Yash Javeri, Head Critical Care, Anesthesia and Emergency Medicine, Regency Superspeciality Hospital, Lucknow. Dr. Hema Divakar, Medical Director and Senior Consultant of Gynecologist at Divakars Speciality Hospital. And Dr. Swati Maheshwari, she's an internal medicine specialist. Thank you so much to all of you for joining us on this discussion. Very important to talk about hand hygiene when we are, struggling with a pandemic, the second wave proving to be very, very deadly. Now, while we do focus on pandemic, tuberculosis has killed 4.5 lakh Indians in 2018. This is an infectious disease. And, one can also add cases of hepatitis and many more vector-borne diseases in our country like malaria, where there is significant burden of disease. Now, pathogens abound in our country, especially when it comes to tuberculosis. It's like people say it's in every corner. Now, they abound in all corners of our country, but not everyone gets the disease. So, I want to start with you, Dr. Makharia. I want to understand, when there are pathogens all around, how is it that some people get the disease and some people don't get the disease? What is the role of personal hygiene, especially hand washing, in determining who gets it and who doesn't?
Thank you so very much, Anisha, and thank you, ISC Council, for taking this initiative for increasing awareness about general hygiene and hand hygiene to general public. I think this is a wonderful initiative, and this is one of the very, very important thing in prevention of diseases. We are not talking about treatment of diseases, but we talk about prevention of diseases, which is one of the very, very important part. Diseases once occurs, you treat them, but prevention is always better than cure. And this is the tagline of all medical science, that once you prevent a disease, is always better. So therefore, we know that we are all surrounded by microorganisms, not only surrounded, but also inside our body in different parts, be it skin, be it our GI system, be it our nasal cavity or so. There are a lot of microorganisms there. So it's all ecosystem of microorganism and the human that keep a balance, and therefore we are protected from. But it's not always though. Once there is a barrier to any kind of breach in barrier, then we are exposed to infection. We're coming to looking at our environment. In our environment, everywhere there are bacteria, there are viruses, there are parasites. We are all surrounded by that. And our body structure prevent us to get infected. For example, skin will protect from getting infected. And if there's a breach in skin somewhere, one can get infected. If you look at nasal cavity, there are hairs there. Even if you inhale some kind of microorganism, they will be removed from the nasal cavity. Here comes the role of personal hygiene. That personal hygiene means if you keep yourself clean, you will prevent infection. And once talking personal hygiene is about overall hygiene, like bathing every day. And of that, most important is hand hygiene, because by most of our microorganisms to which we are exposed to, they get to us through our hands. So if my hand is infected and I touch my mouth, I touch my eyes, or I touch my nose, this infection from my hand can get inside my body. Therefore, hand hygiene or cleaning your hand is one of the most important thing by which you can prevent diseases.
Right. Dr. Divakar, you have a lot of experience in working with women, with children, across all strata of our society. Now, Dr. Makharia has highlighted the importance of hand hygiene. But do you think the social strata, where you come from, really also impacts how much importance we put on personal hygiene?
Thank you, Anisha, and happy to be back with the IHW Council. Simple things, but very, very important and a significant discussion that we've had in the previous session as well. On one hand, you may say nothing is in your hands, but actually everything is right there with the focus on the hand washing, with the 20-second, with the 6 steps, everything that has been brought so much to the forefront because of the COVID pandemic. So as Dr. Makharia said, the specialists and the super specialists, okay, only in the recent past, both the mindset of the people and the doctors are changing. Prevent illness and promote wellness. Okay, that is, slowly, steadily coming into the forefront. Otherwise, generally the mindset of our people, especially in our country, where there is an issue with the basics of roti kapda makan, they say, okay, we will see when the time comes, or we will see when, the problem happens. So in medicine, there is the PSM, which is a specialty subject. It's called Preventive and Social Medicine. It is titled like that. All the public health specialists are basically the PSM qualified cadre because the prevention and social factors, they really go hand in hand. And then Ravi Bhatnagar ji was saying, and Kamal ji responded to the fact that many, many millions of pregnant women, from there the lessons have to begin. And he also said India is an NCD hub. Yes, the programming of the child starts in the womb. So it's through the mother that the generations of the health and prosperity of the country are defined. So when we say hand washing, for us, it may look like a simple instruction. Therefore, saying it with conviction, saying with enough importance to drill it into the minds of those whom we are talking to, it's not a it's not a glamorous thing to say. That is, it's taken very casually, or many times it's presumed that the women, children should know about it. When you mention about the social strata, when we went to the schools for the health and hygiene programs of the girls, and also in the garment factories for women's health, they had absolutely no idea about the importance of hand washing. And the constraint there is, you may say hand wash and hand wash as many times as you want, but where is the running water there? So everything in the environment have to gel. And then when we write the protocols for the delivery care or labor room management, for example, I used to always wonder why in the infrastructural requirements they have said a wash basin with running water, because those are the primary basic necessities in an outpatient in the gynae department or in the labor room, which in many of the public hospitals, even today, you will see one little wash basin in one corner, and the staff is so busy that they cannot go reach there and wash their hands, and therefore the alcohol rub or the hand sanitizer, that has become the kind of norm because the running water is just not available. The same thing when we preach and they have to practice, we have to create an enabling environment for them. Just by saying you wash and then there is no water. So that is why, as Urvashi ji said in the last session, the integrated approach, whoever is responsible for facilitating, doctors are one small component. We can only tell them the importance of the hand washing, but the public health for prevention, the social changes that need to be brought in. For example, religious leaders saying cleanliness is next to godliness. Once that dictate comes, everybody falls in line with the behavior change. So whatever works. So this has to happen in a way that people need to understand that we as doctors are good at, elaborately discussing complex things. But when it comes to very simple things like hand wash, we either presume that they should anyway be doing it or think that we are not the people to tell them such simple things. That mindset also has to change, and it has to be a part of our routine protocol to ensure that this simple action towards preventive care, which goes has a big yield and goes a long way in really keeping people out of the disease processes and in better health should be underscored and re-emphasized.
Right, Dr. Kishore, when patients come to you, they obviously have a problem or a disease. Now, would you then talk to them कि पता है आप अगर आप ये करते तो आपको ये नहीं होता? Is the patient enough to listen to all this? They want to cure, right? They're suffering. कि किसी तरह कुछ दवा दो डॉक्टर कि हाथ होने से क्या होगा? So, Dr. Divakar is saying that we as doctors can only do as much. But do you think you can underline for them that this will really make a difference?
Thank you very much for inviting me for this summit. Hema has rightly said about some PSM, value of PSM in different discipline. And Dr. Govind has highlighted some of the things which you have said. We are finding difficult to, educate the masses or empowered masses for their, behavior, which is a very difficult behavior because of, the behavior change communication has to have the conducive environment, the helping environment. And unfortunately, it is not available. And we think that this is the individual issue. The health is not an individual issue. It is more of, bigger and governance issue and bigger than individual. Although we are teaching our everybody and we are teaching our student for the sanitary barrier, and nowadays we are talking about this nursing barrier, but sanitary barrier, we are teaching from the first year onward the students, and that is actually decreasing almost 60-70% of the burden of the communicable disease if we have the sanitary barrier. It includes the hand, flies, soil, and I think fluid and food. So the hygiene includes all this. The hygiene means like, you have the practice of maintaining health. And what is health? Health is actually whole, whole thing. And that is completely in itself. And that is not deficit of anything. That's make the health. So very interesting. To achieve that wholeness, we require hygiene. And hygiene, the word has come long time back. It's related to Greek and Roman mythology where hygiene was a goddess of, health. And actually it is a practice through which you can get the health. So hygiene and health is same. It's very close to one another. Health is, a state, and to achieve that state, we require hygiene. And that is why we have the hygiene, hand hygiene, we have food hygiene, we have, personal hygiene, even we have the mental hygiene, social hygiene, so many hygienes are there. So we are teaching it, but the problem is the conducive environment. It is not there. Almost 2 billion population do not have the good water supply. They have the contaminated water supply. You can imagine that out of the 7 billion, we have the 2 billion. And if you go to, if you include India, then you'll find that some of our rural population, we don't have a proper, even in our urban areas, we have a big slums, and also our hospitals, many of the hospitals coming, you will find problem. As Madam has rightly said that we don't have water supply. If water supply is not there, forget about it, what, health hygiene would be there. You will use so many chemicals to, clean your hands. But in the end, this is not a good idea to use so many chemicals. The WHO director is there. Her name is Dr. Maria. She said that healthcare facility without wash is not a healthcare facility. You can imagine if you do not have very proper, water supply and sanitation, it does not. But if you go to our sub-center, primary health center, community health center, even district hospital, we are visiting district hospital, you will find no washroom, no place for washing hand. So just we are talking about hand hygiene, but it's not there. Problem is so many. If we cannot provide the water, next the fight would be about the water. It starts from the school. You just go to any school, the government school. We have very less private school only located in, urban areas, but in rural areas, the school, we don't have the toilets. We don't have the water to drink. And whatever drink is there, all contaminated, and the thinking about hand hygiene is, I don't know. Many a time, some of our experts say it's good for us because it improve your immunity, because you have a lot of infection keep occurring. So it's also a very nice one. Even we have the hawkers, vendors on the street side. We have so many hawkers, and we don't have any provision by which they can have, hand hygiene. They don't have proper, place to wash and to have, they go for pee and then they don't have water to clean. So the question is that, we talk about it, but where to do, what to do? The resources are not there.
Right.
So,
the resources are definitely a constraint. Dr. Javeri, COVID-19 has put the focus on hand washing. But what are the other diseases that people don't think about, that they may be at risk because they've not washed their hands, or because they don't have hygienic practices? Could you tell us some of those that can be easily prevented by hand washing?
Yeah, thank you for the question, Ms. Dhawan. Actually, it's a very, very sad state of affairs that after 70 or more years of freedom, we are still trying to struggle with basic things like hand hygiene, and I think the country should be ashamed for this. Anyways, there are many diseases which are prevented by hygiene. Notable remains diarrheal illnesses, many respiratory illnesses, upper respiratory tract infections, infections in all immunosuppressed patients. Even wounds can get infected if proper hand hygiene is not taken care of. Many diseases of gastroenteritis, urinary tract infection, if proper hygiene of hand hygiene as well as perineal hygiene is not taken care of, can lead to urinary tract infections also. Apart from that, all diseases when the patient is at home care or in the hospital, hand hygiene remains an important tool for preventing secondary infections. In India, almost 50% of the patients who have been hospitalized die because of sepsis, which is acquired during the hospital stay. This sepsis or infection was not there when the patient was admitted to the hospital, but these are secondary infections. So we have a very long way to go in terms of preventing these infections, and hand hygiene is the single most effective tool which can cut down these infections. And probably God has shown us some light, and we should be now very serious about it, at least after this pandemic. We should put all our resources in basics. What happens in this country? We go by media trials, we go by high cost medicine, American model. We don't focus on basics, and hand hygiene is one of the basic things which should be adhered all the time. I will give you an example. When you go to see your own child in the nursery, you are so serious about hand hygiene. You put a gown, you put a cap, you put a mask. While you go to see another patient, you are not just bothered, most of us. So our intent has to be there, and if the logistics is not there, we have to give it a serious thought, and we have to look back into basics, all of us. Thank you.
All right. Dr. Divakar, I wanted to ask you that, sometimes, you highlighted, and others have also highlighted the lack of resources for which, even though you want to accomplish something, you can't. But then it's not just the infrastructure not being there. Sometimes it's also about behaviors, right? In Swachh Bharat Abhiyan, we've seen construction of so many toilets, but some of those are not even being used. So when it comes to hand washing, is there a behavioral block?
Yeah, I think one of the primary reasons for the behavior block is all of us are saying that it is so responsible for like 50% of the infections which can be prevented. So I don't think people get it. They don't understand that such a simple thing that they do goes such a long way in their improving their health parameters and preventive care. For example, we did a huge initiative from the Unilever where every mother was told that she has to absolutely keep her hands very clean, wash them before handling the child and before feeding the baby. And also it translated into her telling everybody else in the family that don't touch my child unless you wash your hands and they're clean and then you come. So that is how the ripple effect of where it matters the most. The mother is so most concerned with the child. We say that you can get into an infectious stage if you're not keeping it clean, and that may be the forerunner of many problems with your little one. Then that whole message goes around and the entire family does a few notable changes in their behavior. Similarly, when we went to do the health and hygiene programs in many schools, we had tied up with ISKCON midday school meal. Then they wanted us to document and give the feedback about the meal, the content of the meal, which will promote good health. What we brought it to their notice was no clean drinking water, and children do not wash their hands before eating their meal, which is like one crucial important step that they have to do because there's no water available in the school. Then we got those things through the resources through ISKCON itself. We said just not providing them the meal, but everything else around that you have to pay attention to. And out of that simple study and a simple initiative, all the schools now under that cover are having, and it's compulsory for all children to wash their hands before they sit down for the midday meal, and so on and so forth. The same thing in Anganwadis for the pregnant women when we do. And that has to become their routine of washing their hands, because as Dr. Makharia said, it is the hand through which the infection can go through the mouth, nose, eyes. That is the entry point. So these simple things in an effective way, so that they're not doing it just because we are saying, they're doing it because they understand why the simple action of theirs is so crucial in just, cutting down the size of the problems of around the diseases that they can have. I think this message has to go very repeatedly on forums such as these, because we, being in the specialty, super specialty cadre, are coming down to earth to explain this simple logic of why this action is important. And I think that should be told by many of us more often, so that everybody recalls and this resonates into their behavior change and it becomes a way of life.
All right. Dr. Swati Maheshwari is also with us. She's an internal medicine specialist. Dr. Maheshwari, for doctors, what should be of primary importance? Should it be treating the patient? Should it be prevention? Should it be explaining to them that how prevention is done? What can be, how diseases can be prevented, and how important hygiene is? Because doctors have a lot of patients to look after. So if we want, this is our initiative to put the focus on hand hygiene. But how does the message get drilled down? Because even in similar communities where the economic strata is similar, some people may be following, the practice of good hygiene, the others may not. So who can we enroll so that, the message drills down?
Absolutely. Thank you to IHW and the Dettol for roping me in for this interesting session. And thanks, Anisha. That's a very good question, I would say. See, definitely doctors have a bigger role to play than just treatment. And of course, when we talk to our patients and we, do counseling sessions with them and everything, then we do highlight a lot of importance about preventive health as such. So most of the doctors sitting here at the panel would agree with me that, we try to build up on that as much as we can, because treatment, we do understand, is one corner of the entire spectrum that we see. But prevention is the key, and no matter what, we need to really focus on that. And, if we are talking about hand hygiene, then I must say that when we are talking to patients, when we are talking to parents especially, then we need to make them understand how important it is to drill this hand washing thing into the children from the start, because most of the behavioral studies show that the hand washing patterns that are established mostly into the first of the life. And this continues, the imprinting continues with us for the rest of the times. So, and we know that kids, for that matter, they explore the world more in a tactile manner. So, there are more infections that are there around. And parents especially need to understand, and the would-be parents that need to understand through a doctor's perspective is that what we have seen with all these kind of hygienic diseases, they impact the life of a child. The studies that are there, and even if I talk about the simple childhood diseases, which are most common as well, like intestinal helminthic infections and the diarrheal diseases and all, then what we have seen is that these simple diseases, and which are related to hygiene the most, can impact not just the growth and the fitness of a child, but the cognitive functions of the child as well. And it has even, it's a very vicious child. His appetite goes down and he suffers from malnutrition. That malnutrition brings down his immunity, and again, it's a vicious cycle that continues with the child. And what we have seen that impact our genetic imprinting as well, and we have seen that the DNA regulation that happens with methylation and the effect that it has, it can extend to generation second and third. So it's not just the child who's getting impacted, it is the coming generations as well that get impacted, which is very interesting to know. Also, I would like to highlight that most of these disease studies that we have done, they have shown that the early heavy disease child burden that the child carries, kind of impacts his functional and nutritional outcomes as well. And we all know about stunting, that, the child who suffers repeated infection, his linear growth shortfalls occur. And there was a very interesting study in 2001 which actually tried to quantify it as well. And they said that the child who suffers from repeated helminthic and diarrheal infections, their linear growth shortfalls extend beyond 6 years as well. So there was close to 3.5 inches shortfall in a child who's 7 years old. So, these kind of things impact, and not just his linear physical growth, even his performance at school in later years is very much impacted by the kind of nutritional deficiencies and the repeated disease burden that any child suffers. So, we need to highlight these important points to the fact that even the frontal lobe development of a child gets sluggish if the child undergoes repeated infections. And hygiene is one core thing that can help us, because there was a survey that showed that even the phonetic fluency of a child at 6 to 7 years is impacted by early childhood diseases if a child gets repeatedly ill. So, there are so many things that we can highlight as a doctor, and we can bring it to the notice of the parents, because, most of the time what parents feel is that, okay, my child is sick right now, we'll get out of this entire cycle and then things will be okay, and, we can build up on the child later. But we do need to understand that there are many problems which we cannot relieve later, even if we try as much as we can. So, like we say, first 1,000 days, the nutrition in the first 1,000 days of a child are so important that even if you build on them later, you cannot fill in the deficiencies that happen in the first 1,000 days. So, this is a very, very paramount importance that we, kind of use the various behavioral change methodologies that we have now, which can increase the uptake of the hand washing by the parents and by the children, because as I said, it is the first 10 years which actually impact the hand washing patterns of a child. And see, if you look at the disease burden also, as I might say, if you look at hand washing, it kind of decreases the diarrheal disease incidence by 1/2 and the acute respiratory disease infection by 1/4. And if you look globally, there are close to 3.5 million children who lose their lives every year just to diarrheal diseases and all these upper respiratory infections. So if we can cut down on that just by hand washing, and hand washing has been considered to be more effective than any single vaccine or any other medical intervention that is known to the world. So we can really understand the importance of hand washing, and I think doctors should definitely, and I believe that most of the doctors do that as well. When we treat people, we tell them about preventive medicine also, because at the end of the day, we are responsible in instilling that knowledge into people as well, because they otherwise don't know where else to go. And when they hear from a doctor's mouth, it becomes gospel for them as well. And they do understand that how important it is for hygiene to be maintained at home, and also, how to inculcate these habits into children. Because especially now, and with the renewed attention that Corona has brought in, obviously, we do understand the importance of hygiene, the importance of immunity and all. But I should definitely say that once the pandemic ends and everything, we do have short memories and everything start falling back to, stage zero again. So that should not happen. And it should be a momentum that should continue, and people should understand how important is hygiene and immunity building from here onwards, at least, because at the end of the day, we need to strengthen our public health systems as well. And it's a sad fact that we poorly understand our public health system, be it public, be it the decision-making people or the policy-making people. I think public health is something which has really been underestimated and not understood that clearly that it should be.
Right.
So we
Right, but Dr. Maheshwari, when it comes to public health, so far, the focus has been on building hospitals. It has been on treatment and not prevention. So, Dr. Javeri, you've also said that, 70 years and our resources are not ready. What are the resources which are not ready? Do you think that treatment through tertiary care centers is the way to go, or should the focus of public policy be different?
Thank you for the question. That question is very close to my heart, and probably this concept should be very close to all of us. We have not focused on basic care at all these 75 years. We do not focus on emergencies. We do not focus on disease prevention. We do not focus on acute care. What is our focus on? Our focus is on transplant. Our focus is on keyhole surgery. Our focus is on quality of end of life. See, this all looks and sounds good in ivory towers, but if you go even in a hospital which is not a prime hospital in NCR and Mumbai, things are vastly different. So we need to realize that there are two Indias. Still there are two Indias, and there is a lot of heterogeneity in the level of care. What we should have done, we should have built our systems up to a level where at least the basic care would have been delivered to all the needy. Many cities, many big cities, you won't have a good emergency department or a critical care department today also. You have to find a good emergency department to enter into. But the same city will have state-of-art laparoscopy and bariatric surgery department. So this is absolutely wrong. And not only the government policies have failed, we as private healthcare institutes have also not rightly focused our needs on. We should have looked on priority basis. What we are doing everything on commercial basis, whether it's a government institute or a private institute. Government institutes also, many government institutes, I will not say all, the level of acute care, the level of preventive measures is very, very poor, including private also. Infection control, which should be the mainstay in prevention of secondary infections in this part of the world, have no muscle. There are infection control committees on paper. Many a times the head of that infection control committee has no idea what infection control is. And he is handpicked up by some person because he is blah, 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 blah. So that needs to change. We need to give muscle. We need to empower our frontline healthcare workers, the nurses, the junior doctors, the technicians. You tell a surgeon, do hand hygiene 100 times, hardly 2 or 3 times he will do it. He will be very, very religious in doing hand hygiene in the OT. But if he comes to the ward or to the ICU, he will just forget its concept. So is it only a behavioral issue, or it is a loose policy from the organizations? If we leave everything loose, we know what type of country we are. So that thing is going to work. So we have to be punitive. We have to be serious about the business of infection control. The aim should be primum non nocere. If at least you cannot do good, do not do any harm to the patient. And we always say clean care is good care. We all know this, but see, it can happen in emergency. When you are in a dire emergency, the crash situation, you can at times skip hand hygiene, but making it a routine habit 60 to 70% of the time is not the right way. When you know the concepts, when you have been reinforced again and again, but still you don't follow, this has to change.
All right. Dr. Makharia, then what would you say, how can, Dr. Javeri is talking about medical professionals being careful about this. Now, of course, they treat patients, but they're a small group of the entire population. We're talking about the entire population now becoming more cognizant of how important it is to have good personal hygiene. Now, does the onus rest on the medical community to get this message across? Because after all, you're the one who is going to bear the burden of disease and treat the disease. Or is it going to come through education? Is it going to come through customs, rituals? How are we going to increase awareness about washing hands and whatever it takes, even if there are resource constraints, to be mindful of hygiene?
This is the key question. I think all of us, all the panel agrees, and that hand hygiene is one of the single most important thing which can prevent a lot of diseases. And I couldn't agree more than Dr. Swati that good hand hygiene has potential to decrease diarrheal disease, which takes life by almost 40%. We can prevent 4 diarrheal diseases of 10 if we have good hand hygiene. We can prevent at least one in 5 respiratory infection like common cold or pneumonias. More importantly, one more importantly I want to highlight before I go to how to do it, that once we have a GI infection or lung infection, we use antibiotic. And although antibiotics should not be used in all diarrheal episodes, but most of physicians will use antibiotic now, which are also available at over the counter without prescription. And most people will take antibiotic for a single episode of acute diarrhea, which lasts for 2 or 3 days. Therefore, there is a misuse of antibiotic. And there's a misuse of antibiotic leads to antibiotic resistance. And this is one of the very important challenges which is now coming up, that we don't have good antibiotic which can use when they are required to be used. We don't have. Therefore, if you prevent infection by these simple measures like hand hygiene, you can prevent use of antibiotic, and therefore we prevent antimicrobial resistance, which is a big challenge for the whole global community. Other thing which happens is a long recurrent infection will lead to, which are preventable in nature, will lead to short stature. 25 to 30% of our children in our country are shorter than they should be, and all this are likely to be to get better if we have better personal hygiene and hand hygiene. So, having said that hand hygiene is of utmost importance, not only in the healthcare setting, like in hospitals or by doctors, but also by general public. Question: how do we reach them? Now, this pandemic gave an opportunity that a lot of public health deliberation happened over all kind of media, including print media and visual media over last 1 year, and it had been highlighted almost every day 10 times that wash your hands, wash your hands, wash your hands, and that's messages have been conveyed repeatedly to most people. Question is that will we be able to maintain these practices once the pandemic gets over, hopefully soon in coming months. And this is not about, so this has to continue. And all of us, so all healthcare professionals or like community, all those people have interest in public health, like media, like what you are doing, ISW Council is doing. So all of them have to should maintain, each one of us should maintain this kind of a momentum. Because to reach a public in a small town or small village is not easy. Even if you reach there are challenges. So we'll talk challenges later. But first you need to reach there to fix in mind that if you clean your hand, whatever means you have, be it soap water, we have a little water, we have more water, we have alcohol-based cleansing agents. If you do it, you will feel better. You will prevent infection. First thing to reach them and to convince them that this is an important. Then come challenges, which Dr. Javeri and Dr. Kishore also told about, that we have resource constraints, we don't have infrastructure. But that's what people are realizing now, that this is important. This is important factor, and we must create infrastructure, which is also being done. It's not that nothing is being done. There are a lot of infrastructure changes have been done over last, I would say, last 70 years, not last 10 years, but over years. Our infrastructure have improved from none to a lot. We have not reached to our rural population as much as we should have reached, but still the effort has to go on. I think we should realize there are challenges, but again, challenges have potential for solution also.
Right. Dr. Kishore, we heard Dr. Maheshwari say that, you cannot take hand hygiene lightly, because infectious diseases in early life will lead to long-term impact as well. In your practice, do you think the patient is aware of this? Can the medical community highlight this? When do they highlight it? When they have an interface with the patient, or through promotional messages? How do we get the message across that, if you got loose motions, it's okay, and you keep getting repeated UTIs, it's okay. You need to tell them that, damage will happen. So you have to stop, taking it lightly. Dr. Kishore, the question is for you. How do you...
my internet was actually not working well. So that is why I just missed your question.
So
and
again, I'll repeat my question. So the question is that, when it comes to communicating to the patient that poor hygiene has led to this infectious disease, it is not being treated here, and that is the answer. The answer is that you are cognizant that you cannot keep getting infectious diseases over and over again, because long term there will be an impact. So when do you communicate this to the patient? Are patients aware of this? Because what Dr. Swati Maheshwari was speaking about, the changes in DNA, is something that I've heard myself for the first time.
Yeah, we are communicating. There are different methods of communication with the patient. And when they come to the hospital, then they realize that their infection or their disease is because of whatever has happened. Unfortunately, many of our clinicians and surgeons are not communicating at that point. They don't have time, so they just treat the problem and then they do not communicate. That is the best time when they can communicate properly that this problem has occurred because of this and you have to improve. But it has to start from the village level, where our ASHA workers and our Anganwadi workers are working, and then beyond, at various stakeholders are there. What the panchayat can do, or what our residential societies can do, they can provide the resources which I was talking about. Although yes, we have the piped water is there, but in urban areas, that only one time the water is coming, and you have to, wake up in the early morning to, fetch that water. Forget about, the states like the Rajasthan, and, we have a Gujarat, a bigger area where kilometers together you don't have any water supply. So infrastructure is created, but that infrastructure in terms of the physical structure. And when we talk about this, the water supply and sanitation, somewhere we are not reaching to that level. And maybe I think our engineers, our bureaucrats, they don't have this understanding that these things are very important. The school attendance or disease are because of the non-availability of water, and continuously they suffered. That is why the problem is there. So we have to educate and communicate at various levels. It is not just the patient. We have to, educate our communities. We have to educate our stakeholders, like, our panchayats, our, municipal corporations, and so many people. Then only this is all possible. For example, I should not talk about, my hospital, but we are developing a big hospital, but there is no sufficient supply of water, and we don't have water for our patients, and they have to get the water from the market, this distillery water, Even in our, many places, our resident and our doctors are making arrangement of their own. So problems are many. What is required is that everybody has to be together. All stakeholders must realize that water becoming a problem. In coming time, we'll have more and more water scarcity. So how best we can use, how best we can reuse, these all things are required. Then only we can solve it. Otherwise, just talking about it, educating them is not going to solve. As I've already told you about, behavior change communication, social behavior change communication is not possible without making available to, or making the environment suitable to change your behavior. Then only it is possible. Thank you.
All right. So we need the environment to change also for the behavior to change. Dr. Maheshwari, I want you to spit the last word in this discussion. All of you have spoken about the importance of personal hygiene so that we can keep infectious diseases at bay. Now, the long-term impact that could happen because of repeated episodes of infectious diseases is something that all of us should consider. Starting at a very young age, you spoke about how children with repeated episodes have an impact on their development. Could you tell us then how much of this awareness and education can be done at the mother and child level? Because the government has a policy where they are engaging with mothers, new mothers, expectant mothers, and they are being taught about vaccines, etc. So now, is this a way by which we can increase the awareness about hand hygiene as well?
Was the question directed to me?
Yes, Dr. Maheshwari, the question is for you.
Yeah. See, definitely. Now, one thing that we need to really understand is that when it comes to doctors, our access to the community is very limited. It's only the people who are falling sick, their parents, these people who are coming to the hospitals, and our interaction is mostly limited to these people. But it's actually the public health system which needs to take the onus, which needs to engage doctors as well to deliver the messages to the community. Because at the end of the day, when you're talking about volumes, when you're talking about people in the rural areas, when you're talking about people who are at the far-flung, at the corner of the country and all and everything, it eventually has to be the public health system which needs to reach out to these people, which need to do epidemiological investigations, do disease surveillance, do a lot of these communication channels that they need to build with the public so that they can outreach to them, make them understand, do behavior modifications and methodologies with them. So it eventually boils down to that. Obviously, they can rope in doctors, and they can take their help so that it is more easy for them to make it understand to the parents, to the mothers, so that they can understand what importance hand hygiene has and how it can impact the life of the child for the entire life and not just these initial formative years. That's the importance. But then again, I would say, we sitting in OPDs and we dealing with patients who are coming in, we have a very limited access to people. But actually, these are messages which should go out into the community. Now, looking at corona epidemic right now, it's an urgent need for each and every person to follow the norms. Otherwise, we know that even if one person falters, he spreads the infection to the others. So it's about educating everyone about these important things, not just the mothers, not just the children, but the entire community, because somewhere or the other, the child gets impacted by how the others are behaving. It's just not the mother behavior that impacts the child. It's his father's behavior, it's his grandparents' behavior, it's his neighbor's behavior. So the child, imbibes everything from around the environment that he sees. So it's essential that everybody follows the pattern, everybody follows the norms that are supposed to be followed. That is the only way we can cut down on these infectious diseases. Because by educating just a handful of section of society, you cannot curb down on diseases when we're talking at volumes, when we're talking at pandemics. And we really need to understand that the public health system has to be strengthened here in India as well. Now, despite all these different kind of diseases that keep outbreaking here in India, the the public health system is still dramatically underfunded. It is not funded, and even the policy and the decision makers and the general public, there's a huge cultural and conceptual gaps which are lying there, and probably that is why the public health system has not been able to deliver the way it should be delivering, and probably the pandemic becomes a bigger problem for us because our entire public health system collapses. And not just collapses, it's actually not there. It's a ghost that we see all the time right now. So probably we need to strengthen this system that we have so that, you know, at the time of such crisis, we are not just left with bareful of hospitals and bareful of doctors who are there to cater to the needs of the public, but actually we need to have an entire system where the local, the state, the central, the public, everybody is roped in and aligned, and they know their roles as to which one is going to play which role. And so that right now, like we are seeing the passing of the buck and the tug of the war that is happening between the states and the center is leading to more chaos right now. So probably if these things are aligned and if these things are already, you know, predefined and they are already laid down that this is the role of this particular segment of the society and this is what they need to play, then, you know, we can see a better future. We can see better deliverance of all these healthcare systems that we have. Otherwise, each and everyone would keep blaming others and things will keep falling apart, and the goals and that we are looking at would never be achieved.
All right. So Dr. Mahesh is saying that it is a concerted effort involving a lot of people. You can't just leave it to one part and say that you do the talking. People will understand. Thank you all for joining us and talking to us about how simple hygiene practices can impact infectious diseases in our country. Let's hope, because of the pandemic, the COVID pandemic, the message is now drilled down to people that hand washing is important. Let's hope that this leads to behavioral change where people make this a habit, not just to prevent COVID, but other infectious diseases that could come if they don't be mindful of good sanitary and hygiene practices. Dr. Makharia, Dr. Javeri, Dr. Maheshwari, Dr. Jugal, Kishore, and Dr. Hema Divakar, I want to thank you all for taking the time out, for joining us this afternoon and talking about the importance of hand hygiene. A big thank you to all of you.
Thank you so much.
Thanks a lot. Bye-bye.
नोवेल कोरोना वायरस का खतरा बढ़ रहा है, तो हम क्या हाथ पे हाथ धरे बैठे रहेंगे? नहीं, हम हाथों को धोएंगे साबुन से या यूज करेंगे अल्कोहल बेस्ड हैंड रब ताकि नोवेल कोरोना वायरस का खतरा कम हो। WHO भी यही कहता है।
डेटॉल द्वारा जनहित में जारी। डेटॉल इंडियन मेडिकल एसोसिएशन द्वारा प्रमाणित।
नोवेल कोरोना वायरस का खतरा बढ़ रहा है, तो हम क्या हाथ पे हाथ धरे बैठे रहेंगे? नहीं, हम हाथों को धोएंगे साबुन से या यूज करेंगे अल्कोहल बेस्ड हैंड रब ताकि नोवेल कोरोना वायरस का खतरा कम हो। WHO भी यही कहता है।
डेटॉल द्वारा जनहित में जारी। डेटॉल इंडियन मेडिकल एसोसिएशन द्वारा प्रमाणित।
So we're now going to move on to our discussion on mobilizing and sustaining community behavior change for hand hygiene. Now, there is no doubt that better hygiene practices, especially hand washing, can save a lot of public health resources, which are disproportionately deployed towards treatment over prevention of disease. In our next panel discussion, we will talk about the best practices and models to trigger community-level behavior change to ensure greater public health outcomes. Now, joining us are multidisciplinary specialists who will share their experiences in urban and rural areas and what innovative solutions can be deployed so that more and more people are aware of the importance of hand hygiene and they make the change in themselves. Please welcome our esteemed speakers, Dr. Sanjeev Kumar, Chairperson of Indian Academy of Public Health, Mr. Rajesh Pandya, Managing Director, KI India, Ms. Shushmi De, Assistant Editor, Times of India, who will be joining us shortly, Mr. Dalit Manhas, Co-founder and MD of Doseri and health communication expert, and Mangesh Wange, CEO of the Swadesh Foundation. A warm welcome to all of you for joining us for this discussion. Professor Kumar, I had this question for the medical community as well in the previous discussion, that at one point of time we keep saying resources nahi hai, pani nahi hai, toilet nahi hai. कैसे होगा ये? आप कैसे sanitary practices improve करेंगे? Then the government under the Swachh Abhiyan program, Swachh Bharat Abhiyan, made a lot of toilets. Corporates got into this in the CSR activity. A lot of toilets have been created, but many of these toilets still lie unused. There's overturn or or just behavior. People are not used to going to the toilet. So what is it? In this chicken came or the egg came first, how do you change behaviors? Dr. Kumar, Professor Kumar.
Thank you for raising this important question. Let's look at what is the scenario. What proportion of people are washing hands? The global figure is around 18%, and we in India know better. It's around the same. And especially in addition to washing hands after going to toilet, washing hands before you feed a baby, that's also around 26%. So a vast majority does not do it. Then I will not go into the second aspect. I'm sure you have discussed in the previous session. What are the benefits? You can reduce diarrheas, you can reduce respiratory infection, you can reduce skin diseases. So there are a huge number of instances where it helps, not just to the community. In hospitals, if you wash hands, there are lesser infections. There is lesser antimicrobial resistance. And then coming to workplaces, if you wash your hands properly, you don't contaminate surfaces and you don't infect your colleague. Why washing hands after toilet is very important? 1 gram of fecal matter has 1 trillion germs. 1 trillion germs. If there is a speck of it after you come from toilet, you have not washed hands or you have touched the surface in toilet which had a speck of this material, you will have a large number of organisms infecting. Coming to the third part, and with this is what you have raised. When you look at any problem, we start with what are the problems. I will give you a very simple example. Having been in UNICEF around the world, worked in 30 countries, I always looked at senior officials coming to meetings, including people who were putting guidelines, policies at global level, at country level. During lunch break, I just used to keep an eye on how many of them are going for hand washing. And they were in 5-star deluxe hotels, no shortage of water, no shortage of soap. Less than half of them. When the last session broke before lunch, large majority of them don't go for hand washing and they go straight away for lunch and start eating. So we always look at constraint, but look at where we have facility. One is awareness. These people are aware. All of them are aware because they are putting policies related to hand washing, hand hygiene, water sanitation and health. But they are not washing hands. So from awareness to desirable practices, desirable behavior, there is a gap. And the same is true. Even I have gone to villages in Africa. They had a small hut. There was no space for washing hands. But outside on a tree, there was a plastic can hanging, which was full of water. When they brought water home, they brought water in that can. It is called tippy tap in that part of the world. And somebody there is a rope hanging. You put your foot on the rope and the water starts pouring. There is a soap piece lying there. You moisten your hands. Then you apply soap and then you wash. So tippy tap, no tap is required, no running water is required. So if there is a will, there is a way. Then coming to the bottlenecks of availability of water, let's start with those who have water, who have facilities. Are they washing hands? And then you can look at constraints where water is not available. In the previous section, Dr. Jugal Kishore went into details of that. When you don't want to do anything, talk of these constraints. There is no water, and so much of Indians don't have access to water. How can they? But those who have access to water, are they washing? Start with them. Those who have water, those who have facilities, those who have soap, those who are aware, but still not practicing. Start with those, and then you can continue. And I'm sure the water mission and Swachh Bharat Abhiyan, etc., are going to improve things. But start with those who have all these things, are still not doing into desirable behavior. And media, you are a media expert yourself. I remember there was a cholera outbreak when I was teaching in University College of Medical Sciences, and we were Guru Tegh Bahadur Hospital had just come up, and it was in the neighborhood. You know, all the newspapers used to give news items, so many fresh cases of cholera, so many deaths. At the end of it, there was a box, what you can do. I don't know why it has stopped. You have COVID, newspapers are full of it. Media, electronic media full of it, and social media is even full of wrong information. But nobody is saying do these three things, do these two things. So the media has a very important role to play. Whenever you give a negative news, also tell people what can be done. Thank you so much, Anisha ji.
We should also give solutions, and that is something the media should also be mindful of. Mr. Pandya, the way Professor Kumar spoke about the examples that he gave, it seems that something like hand hygiene is not really driven by your social economic status. Do you also agree, or do you think this is a cultural issue? Mr. Pandya, I request you to unmute yourself. Yeah.
Got it. Can you hear me now?
Yes. Please go ahead.
Yes. Hello, Professor Sanjeev Kumar. Namaste. Namaste to everybody, to Dilip, Mr. Dilip, Mr. Mangesh, and of course Anisha. Thanks for giving this opportunity to speak in front of the council. Yes, it's very enlightening, because what percentage Professor Sanjeev Kumar gave, that people, 18% or 20+% people are washing their hands, even though they have the facility, and even though they are learned people, like he gave the example, who are making the policy for the world and policy for the country, you know. It is a good observation, which I have also, because I have lived in Japan for last 30 years, and in Tokyo also. There are people who would wash their hands religiously, and there are people who would not, you know. So people who are really washing hands, they have water, and people who are not washing hands, they also have water, but just the willingness is not there. And I agree with Professor that we should start with people who has the facility. Let's not cry on things that इनके पास पानी कम है, ये नहीं है, वो नहीं है. जहाँ है वहाँ से शुरू करो ना, मगर शुरू तो करो. That is the idea of I think Professor would like to say. So I agree very much with him. And today is a World Hand Hygiene Day, and today is 5th May, which is a Children's Day in Japan also. It's a national holiday. So, and I was just a while ago addressing some 100 students in Ahmedabad, in Gujarat, about washing the hands and keeping your nails trimmed. We are a company by the name of Khai, and Khai Manufacturing India Private Limited, and we are we have a factory or plant in Nimrana, and we are manufacturers of nail clippers. Now, when I'm coming here to say something. Please do not misunderstand me, because I'm not here to sell nail clippers. I'm just here to tell you people and to people who are connected with this program that please trim your nails. While washing hands is very important, but at the same time, our food culture is not with forks and knives and chopsticks. We eat by hands and we make food by hand. So it is very, very important. And many of the times, even during this corona pandemic, Mahamari, I have seen all the media people are talking about washing the hands, keeping distance, wearing mask, but nobody is talking about trimming the nails. Now, why? It's a very neglected category, I would say so, because पहले ज़माने में मैंने कई बार कहा है कि पहले ज़माने में the आयुर्वेदिक डॉक्टर जो थे वो कहते थे कि ये बंदे के तो नाखून में भी कोई बीमारी नहीं है. नाखून में बीमारी न होना उसका मतलब क्या है कि he is healthy, you know. They would like to see your nails. Are they clean or not, you know? Because the same nails, the same germs will go into the stomach when we are eating dal or roti or whatever, or sabji. So washing hands is important equally every 15 days, because washing hands is a regular thing. But keeping your nails trimmed is every fortnight you need to check. You don't need to do every day, you know. But still, we take it for granted. And that is the unfortunate thing.
Definitely. We have heard Jack also earlier in the day who said that along with washing hands, keeping nails clean is also a very important part of this entire hand hygiene and sanitation. Now, Mr. Manas, we want to, understand that what will lead to a behavioral change. Now we have an epidemic on. People are scared. So they're making a change. They're making the effort to wash their hands. If they don't have soap, they're using a sanitizer. The effort is being done now. Is this enough to drive a behavioral change? Or is this something that people will forget with time?
Thanks a lot for that question. And I have actually been very surprised with the kind of things that are happening. There are people who have really gone out of their way to make changes in their lifestyle. But I think if India had followed and most of the people would have understood why they need to do it, we would have seen a slightly different story. The way now second wave is coming, I think somewhere 99% of us thought that the day vaccine was launched, Corona is gone. And that's what we are paying for right now. Most of the people have not really understood the I would say, the behavior of this virus itself, leave alone us. I stay in a housing society here. I'm in Delhi. And it is supposedly one where you have a lot of educated people. There are people who have their jobs, startups, business people and all. Yesterday I went and took lift, and there was one mask lying in that lift. Someone took the lift and then thought why to carry germs home. He dropped that mask in the lift itself and he went home. When they checked it in the CCTV camera, they came to know that someone actually reached his floor, dropped it and went. That is the relationship we have with our health. And I'll not mince my words. We don't have a very good relationship with our health. It is very, very reactive. We are fatalist. हम सिर्फ बोलते हैं कि शुभ शुभ बोलो. Don't talk about corona हो जाएगा, नहीं तो सच में हो जाएगा. Those kind of things is what we do. People are not really very, very serious. If you ask me, I haven't really seen a lot of change amongst people. And especially you come to know about it when the peak was, when the curve was coming down. It immediately came back to normal. People were still roaming around without mask. And if you go to a lot of people, you will still find that there are a lot of people still roaming around. In a hospital also, you'll find there are people who are without mask. Fear is a very, very big motivator. I always maintain two things, that it has a product or a service has to either resolve a conflict in your mind, or it leads to a fear
of loss of money or life, then only some kind of a behavior change happens. That's when an insight need to talk to you, which we have seen is happening, but it needs to be sustainable. And that's where I agree with Professor Sanjeev when he said that not a lot of people are really talking about behavior change communication. It is very, very reactive. Most of the people are acting in a very opportunistic manner. If you see a lot of immunity supplements, lot of masks, sanitizers, oxygen concentrator, these kind of brands have come, they are talking to people, but they are talking about not from a behavior change point of view, they are talking about it more from more fatalist point of view, that you might contract this, you might get killed, or these kind of things. They are not really sending out any behavior change communication as we must have seen. Like maybe I might take 1 minute more to talk about some of the campaigns that we have done in the past. I was part of some of these campaigns and not. Like if we look at ORS campaign, why it was so successful? Because the whole conversation over there was not about diarrhea, it was about dehydration. No kid dies because of diarrhea, he dies because of dehydration. That communication was understood by mother, and that's when we saw that a lot of change happened. People today know that ORS is required for any kind of a diarrhea that happens. Polio, it made it very, very simple. It's a very simple step approach. Do boond zindagi ki. Mr. Prasoon Joshi actually wrote those lines, but do boond zindagi ki, it was as simple as that. There was one that we did, which was called Noon Assembly, wherein the whole idea was how to increase vitamin D amongst kids. What we did was we made Noon Assembly part of kids' routine. So when they go for their prayers in the morning, we shifted it from early morning to around 11 o'clock in the morning so that kids can get better vitamin D. It needs to be broken down into simple steps. You tell people to do too many things, they will forget. I think the slug line of do gaj ki duri or mask hai zaruri is a great one. Similarly, if hand hygiene has to become a part of it, I think it has to be a simple step approach that needs to be given to people out there. It has to be based on an insight, and it needs to call out the benefit very, very clearly so that the other person is able to understand what action we want him to take and what's the benefit that they are going to get in terms of emotional benefit or a financial or a social benefit. Like last example I would want to give, like Dr. Sanjeev Kumar was talking about or rather you were talking about how Swachh Bharat Abhiyan and those toilets were built. I was on field work in Lucknow and in the interiors of Lucknow, and there when they have built a toilet, they have called it Izzat Ghar. So because Bahu Betiyan, they are going out and then there are chances of rape that happens or them being molested. They named it Izzat Ghar and the usage is really going higher. We saw that people were using it. It was clean. There was water inside. There were hand sanitization products also which were kept outside, even inside, so that as soon as you are done with something, you are able to use those products. So yeah, I think behavior change can happen, but I think it needs to be done at a larger level, a large level initiative that educates people about different aspects of it and the benefit they can get out of it. Thanks.
All right. We heard Mr. Manas talk about how it has to happen on a larger scale, but who all have to be involved? Mr. Mange, in your mind, because this is, some people say it's public health, so the government has to be involved. Some people say this is a behavioral issue, it's on the individual. So who all are involved here?
Okay, thank you. Hi everyone. Thanks Anisha, Dilip ji, Rajesh ji, Professor Sanjeev Kumar. I think first of all, let me really congratulate you for organizing this. And during this Corona time, while there are three very clear instructions as COVID appropriate behavior, masking, distancing, and hand washing, but somehow you hear more about masking and social distancing, and hand washing really either it is low on priority or just slips while communicating across. You pick up any medium, wherever it is all about masking and distancing, while all the three are equally important, right? So I think this is what tells about the challenge which we have to overcome as a society. I'll tell you a couple of interesting stories and experience based on our work, because as Anisha, you were asking, "Kisne karna hai?" So I think it is society as a whole, and any change, as reading a quote, change in behavior begins with a change in the heart. So how do we do it? So Swadesh Foundation has a strategy of 4E, which is first E stands for engage, second empower, third is execute, and fourth is exit for sustainability. And what is the topic of the day? Changing behavior and sustaining it. Entire work which Swadesh does in Raigad district of Maharashtra and Nasik, we clearly see this day in and day out. And I have so many positive things to share. We all know about challenges. Professor Sanjeev Kumar also shared some very interesting data. Information, data, everything is available. On ground, how do we do it? And that's why I said, this is something which has to be led by society as a whole. No government can come and tell. And here I want to share a couple of interesting stories. First story is about village development committees with which we work for. We have more than 1,000 village development committees, one in each hamlet, which reaches to about 55,000 plus households. And this entire model of Swadesh is holistic, 360 degree. So hand washing as one single activity I cannot focus. It is linked to many other things. So it is a holistic approach. It is a wash as a whole. So water availability has to be there. Entire behavior change around it, and also sustaining that power. So what we do, we have done more than 500 drinking water schemes. It is not that as an NGO we are going and establishing a drinking water scheme. And right from design level, since 5 years, while India started, Mr. Modi said, Nal Se Jal, 2 years back, we are doing it for last 6 years. All 500 schemes, 33,000 households have 2 taps in each household. That was our first program. Then we went on to toilets, 25,000 individual household toilets. So without water, toilet usage and hand washing is not possible. So this entire 360-degree approach, that is the example I want to share. But for behavior change, our first E, engage, is very critical. What do? When I go to a village, we tell about what Swadesh as an organization wants to do and can do. And then we ask them, it is not like I'm going and doing a charity or cutting out a check, doing some activity. No. We want to test your convening power. So as a village, you have to come together. And it may take 2 months for us to start the activity. But what we do, we tell them about our program, our approach. And then we tell them, okay, we will come to your village on a particular day, maybe after a week. And if you are willing, at least 80% of households should come there at 10 a.m. So we reach there. And then we say, okay, let us clean the village. Entire village has to be cleaned, segregate dry garbage, remove plastic, whatever. Some small activity to test their commitment and willingness to change. I think that is the starting point. We get about 60% success rate. And Anisha, that is very important. I go to 100 village, 60% people come forward with 80% people and they do it. We have seen if that is the start, and that is where if you begin with positive change in heart, we are able to sustain it. And we have seen these institutions for sustainability, for communication, for reaching out to each household in that community, make jobs easier and much more participatory. So awareness at macro level, whatever messages come from government or celebrities do help, but it has to cascade down on God, and it should create interest. What is it about? Which we have seen during our campaign on Swachhata Mission. And access, as I shared with drinking water committees and toilets, access is must. That alone will not solve. Through institution for sustainability. And finally, adoption. How that adoption is done to imbibe that behavior. And for that, this 4E model, holistic approach, does help. And not just providing water at home or toilet at home. It is about school Watson also. Again, a lot of data is there. Large number of our schools, especially in villages, don't have proper Watson facilities. And that is another focus area. And we are very thankful to our partner Tata Trust, Reckitt, Benckiser, where the focus was entirely on this holistic approach. So child goes to school, he finds hand wash stations there with proper water supply, disposal of that water into a soak put or to the kitchen garden. Everything has to be 360 holistic approach, so that people, when the kids go back to home, they find their toilet is there, water is there. So I think these are a couple of things which we have to bring in: holistic approach, institutionalization of behavior and access, and also support in execution on programs on ground. Thank you.
All right, we have Sushmi Day of Times of India also with us. Sushmi, Mr. Manas highlighted that, at this point of time, hand washing is in focus because there is fear of catching COVID and the implications on your health. So when communication happens, we want to have a positive behavioral change. How should it be done? Will instilling fear bring about the change in behavior, or talking about its benefits bring about the change in behavior? Sushmi, I request you to unmute yourself and turn your camera on. The question was for you, how should we talk about behavioral change and why we need to bring it about? To instill fear, or should we be, talking to them about the benefits? Okay, so I think Sushmi is not with us for now. I think there's an internet issue. Professor Kumar, let me come to you then. We've heard the speakers say, Mr. Manas also said, डर है पर मतलब डर के आगे भी मतलब कुछ होगा, it's more important for the mother who knows that, ORS देना है क्योंकि डायरिया ठीक होता है. That is not the communication. Communication is कि बच्चा ठीक हो जाएगा. So when we talk about hand washing, what should be the focus?
Now, one is, thanks Anisha, and one is we have to keep in mind that cleanliness, hand washing was very important part of our culture. When I was growing up, I used to go to my Nani's village, and all children are very fond of going to Nani's place, so were we. Those days there was no tapped water supply. We used to get water from the well, and it was only adults who were supposed to handle when the bucket comes out of the well and putting it in a water container that was carried home. We children were allowed only to pull the rope because our hands were likely to be dirty. We would spoil the water, and the place where water was kept, those of the experts and listeners know Indian culture, there used to be a separate place for keeping drinking water that was called paranda. Children were not allowed there. Anyone, even adults, to go to bring the drinking water had to wash their hands before entering there. And they were not supposed to put the container to take out water in the ghada, because then you will contaminate with your hand. And whenever any guest came home, traditional Indian practice still followed in South, but also in North earlier days. They were supposed to wash their hands and even their feet. They were supposed to keep the shoes outside. Enter the house, there was a separate place where their feet were washed and hands were washed. And then they were dried, and then they entered the house. So hand washing has been a very important part of our culture. How do we promote it? Related to our culture, certainly it will carry more weight than you. It's not a Western imported idea. It is a traditional idea which was very much practiced in India. So we need to promote that. This is what our ancestors did, and this is how they remained healthy. Health is important, but hand washing is so important you can't leave it to doctors and public health people. It has to be promoted in schools. It has to be promoted in university, academic institution, and workplaces. Every place where people come together have to promote it. Village Health Sanitation Committee, certainly that is one forum. But every household, every child, my 1.5-year-old granddaughter, my daughter is a physician in Harvard, Boston Children's Hospital. I feel very happy when she finishes her meal. She eats on her own. She is not fed by her mother. She sits on a table, on a chair. She eats her food. Then she is taken to wash hands. And then my daughter explains to her how to wash hands. The correct technique is more important than just, tokenism of washing hands. So we have to promote in every household. Everyone, right from early childhood, like 1.5-year-old daughter, I am surprised, granddaughter, can do it. She took a few months of practicing, but now she can wash her hands. She is held up on a wash basin, the tap is open, then she takes soap, rubs it, almost like a surgeon before he does surgery. And then she is very happy, looks at the mother to dry her hand. So it's everybody's responsibility. Don't leave it. I think it is too important to be left to doctors and public health people alone. It has to become part of everybody's life. Everybody has to promote it. And the message should be, even one slip up, you don't wash your hands once in 10 years, 5 years after you come back from the toilet, that is enough to give you disease. So it has to be practiced every time, many times a day. And the Hindi saying, Savdani hati, Durghatna ghati. Once you don't wash your hand properly, you will get infection. That is how I feel it should be promoted. Thank you.
All right. So we have Sushmi, who's joined us now. Sushmi Days with the Times of India. So, Sushmi, we are discussing how to increase awareness, how to bring about a behavior change by communicating the change that is required. Now, we've seen examples given by Professor Kumar, by Dilip, in the work that Mangesh is also doing. Now, we had it in our culture to leave our shoes outside, wash our hands, even before drinking water. So what has changed? Where has all that learning gone? Why are we, facing so much problem because of, infectious disease burden and, the lack of hygiene? For some reason, Sushmi, we are unable to hear you. Can you unmute yourself? I think there is some internet issue that we cannot hear Sushmi. Okay, till the time Sushmi fixes her audio, we are unable to hear her. Right, so I'm going to ask this question to our other panelist, Ms. Pandya. It can be done. What Professor Kumar is saying, it can be done, and it was part of our culture too. But now it's different. Because of poor hygiene, we are seeing that the increase in infectious disease is quite high. So, what do you think has led to this? Have we moved away from our roots? Is it the lack of resources? What has led to this disconnect? Mr. Pandya.
Washing hands and keeping your understanding the importance of washing hands, as this Mr. Sanjeev Kumar, Professor Sanjeev told, it is in our culture. We don't have to learn from zero. If you go to a Gurudwara, there is a big pond. If you go to a mosque, there is a big pond. Even in the Buddhist temples, which I have been many, many times in Tokyo and in Japan, there will be a small spring water there, and you will wash your hands and you will gargle also, because you want to be presentable in front of God, So these are the things which are in our culture. We do not need to learn. But what is happening that we होती है चलती है, चल जाएगा, इसमें क्या बांधा है, that's the mentality and see now, as Mr. Dilip said, that there should be a kind of fear in people. And today, there is a fear of pandemic, of corona. So people are very cautious. But we can see the first wave and the second wave. In between, we were totally, what you call, lethargic. We forgot everything, you know. The moment, as he said, the moment we found the vaccine, we thought, koi wada nahi. Kumbh Mela mein bhi chaliye, election bhi karo, maza karo. But all of a sudden, when this happened, IPL band ho gaya. अमेरिका ने इंडियंस को जाने के लिए बैन कर दिया. All these things are happening, you know. This is fear. So, fundamental thing is, of course, to wash hands. This is the most important thing. And when I'm telling washing hands is important, I'm adding one more thing, which is, जब हम नाखून काटते हैं, तो before we cut, we wash our hands. Why? थोड़े नरम होते हैं काटने में, अच्छा, it is easier to cut, you know. And then again we wash our hands after cutting the nails. Why? Because the germs which are there still under the fingernail, we wanted to clean it up, you know. So washing hands is, as I said, is a regular thing. And it should happen every day. And that is, there should not be any compromise in that, you know. But people, they just forget it, you know. They just don't care, you know. That is the problem, you know. The conscious is there. They know. जानते हैं मगर करते नहीं. That's our problem, you know. So it should become a habit. Right now we are having a campaign with JICA, Japan International Cooperation Agency, which is one of the largest Japanese agency, JICA. You might have heard the name. And we have started a campaign for 1 year, which is called Achhi Aadatein campaign. And we went to Surana village in Uttar Pradesh in January, and we distributed nail clippers, masks, and a portable water tank. I was surprised to see that so many children from the village, they saw nail clipper first time in their life. Mask, they saw first time. I was really surprised, you know. So for me, we need to go more interior and educate people, and it's a concept of behavior. How do we behave? And if we wash our hands, keep our nails trimmed, we will save lots of money for the health insurance also, and for all the hassles which we go through. And that's the most important thing.
Right, Sushmi is with us now. So, Sushmi, Professor Kumar said, and Mr. Pandya has also said, सबको पता है कि ये करना होता है और पहले करते थे सब, घर के बाहर जूते रखते थे, हाथ धोते थे, पर अब people have just become callous. In, you know, there are a lot of things happening that, you know, IPL cancelled or flights out of India being stopped by some countries. Why aren't we serious about this? How do you talk to people to take this seriously? Do you show them the fear side? Do you show them the benefit side? How do we do this?
Right, Anisha. Sorry for the initial goof up though. I think all of us are working from home, so these are some of the challenges that we all face. I hope all of you can hear me now. Am I audible?
Yes, yes, we can hear you. Please go ahead.
Okay. So to answer your question, you know, there are multiple ways to look at it, and there are multiple challenges and factors which have influenced it over years. And like one of the speakers pointed out, that it's part of the Indian tradition to wash hands to when one goes to Gurudwara or even to actually mandir. You wash your feet. This is part of the customs. I remember, the way I've been brought up. My mother used to insist that as soon as we come from outside, enter the house, we should first wash our feet. So that's, but are we losing those things, those practices? Is there a Western influence to a certain extent? These are questions which we all probably need to think about and reiterate in our lifestyle once again. So all the best practices or good practices that were being followed culturally for ages need to be reiterated, brought back to life, as is being brought back to life yoga, meditation, which have also been part of the Indian cultural system for a very long time. So there is need to look back sometimes and take the good practices from the past, and a lot of it has most of it rather has a scientific basis to it. Hand hygiene has been part of the Indian culture for very, very long. It has been part of Indian textbooks as well for very long, but for some reason or the other, the focus got defocused, and probably just the way internet has taken place of books, wipes have taken place of soap, have replaced soaps, and sanitizers have also replaced soaps. Though we need to move forward scientifically and adopt some of the good practices, adopt sanitizers as well, but we also need to think and look back and some of the practices which have been there traditionally, washing hands before we sit to eat. One must wash their hands, and these have been practices which have been taught over years and years at home and schools. It was never, I think it had never come to a point where doctors have to really tell us that you should wash your hands before you sit to eat, or you must wash your feet or hands after you come back home. These are things which have been taught to children in schools or in families. So, but unfortunately, these are things which are now doctors have to tell us and remind all of us together. So yeah, I think that's the way to address. People need to, this has to be part of upbringing, has to be taught as a daily practice. Like you teach a child how to eat and how to walk, you have to teach a child how to maintain basic hand hygiene, basic sanitation practices. It has become very, very important, and nature has actually reiterated it, has
right.
Made us think back, look back.
Right. So now I'm going to take closing remarks from all of you. Let me start with you, Dilip. You gave us a lot of examples of how what works in communications. Now, what more needs to be done? There are a lot of people working on the community level to drill it down on people. Do we need mass campaigns? Do we need a personalized touch? What is going to work to ensure that this becomes a habit, which is not necessarily associated with disease and suffering, but with a good habit, with good sanitation practices?
Yeah, thanks a lot. I hope I'm not on mute. Yeah. So I think first of all, I would want to just clarify one point. I think when I spoke in the initial bit about fear driving behavior, fear is something that is innate. You can feel about these things, like fear of death, fear of losing something, fear of losing an opportunity. But I don't think that should be a part of communication. Communication should take a slightly more empathizing look on that fear. Let me give you an example. Health insurance, or even insurance otherwise, was always done through LIC, and LIC was always about insurance for death. पिताजी मर गए, wife is widow, बच्चे को खाना नहीं मिला, you will have a suffering life. Around 20 or 15 years back, ICICI spoke about Jug Jug Jio. They changed the conversation from insurance about death to insurance being about fulfilling life. Today we talk about Sar Utha Ke Jiyo. It is about this fear in someone's mind to say, what happens if I don't die the day I retire? If I don't have enough money? Sar Utha Ke Jiyo, and that's why retirement plans are doing so well, because it repositioned the conversation. Similarly, in today's context, I think we need to take hand hygiene, create a habit out of it, but have a more empowering, more empathizing outlook towards it. Create campaign. I think mass movement campaigns really work well. Or if you look at ORS campaigns or even Pulse Polio, it reached masses. It led to that kind of a behavior change, because at the end of it, it spoke to people at a very personal level. People could identify. There was a fear at the back end, but that fear was not communicated. What was communicated was what happens if you take care of that fear. So that is, I think, an ideal approach to look at these kind of things. Secondly, from a communication point of view, like Mr. Mangesh spoke about 4 E's. When we used to do communication, we always used to look at 5 E's that you need to keep in mind. First is empathize with the other person. Understand his life, his context. We can't have one communication, one size fits all. It can't work like that. Second is ease of use. Make it a habit which is easy to follow. We can't follow everything. Look at Baba Ramdev. He created whole empire on just one thing. Inhale, exhale, inhale, exhale. That's what he has done. He has just simplified breathing to that level of, I would say, dumbness. People understand it, and it has really led to that behavior change. Today, you think that diabetes can be taken care through just these 2 things. Then empower them with information, with education, with everything that is required, all the tools that are required. Entertain them. I think people are looking at these kind of things. You need to entertain them. You need to give them information in a easily digestible manner. And last, of course, is the economic sense. I think that is an important part in a culture like India, wherein everything will be looked through the lens of money, through the lens of what benefit I get at the end of the day. So these are the 5 E's that I would put together. Definitely, as you asked me, what is required? It requires a mass movement. It requires a lot of people to come together. Like when ORS campaigns was done, around 50 pharmaceutical brands came together and they said, we will manufacture ORS, which is standardized as per WHO recommendations. And that really led, because usse pehle ORS was anything anyone wanted to create, and it led to a lot of issues amongst kids, because electrolyte imbalance was a big issue. So, and government was there. There were NGOs that came together. There were distribution partners who came together, and it almost created an ecosystem. And in this case also, I think something like that is required. Thanks a lot.
All right. Mr. Mange, through your experience on the ground, what you think works in the most effective manner? I'd like to take your closing remarks.
Can you please repeat? I missed the last part. What exactly you want me to tell?
What works best? Like we've heard Dilip said that, it takes a whole lot of effort. It's just not community. It's mass messaging, it's family, it's culture, it's everything. In your experience, what works best? And what can be done so that this becomes second nature to everyone?
Okay, as I said, community is definitely there, but within community, I think it is the women and children. I think these are 2 big audiences which should be part of any communication. Women will do anything for health of the child, of the family. I think they have to be very integral part of any communication. And for enabling them so that they can sustain and are able to lead that life is to provide access to clean drinking water. That is the basic stuff, right? So enabling, and I'm largely talking of rural conditions where even today water availability is a big issue. So access and enabling rural women and children is a big thing. And schools, of course, we do prayer in school. Why not start with a single message on hand washing? I think so there are ways of doing it, but I think these are 2 clear things we should focus and emphasize again and again and again.
All right. Sushmi, you said, this was part of our culture and, it was something which is always done. how do you think we can drill down this message so that people make it a habit and they try to find the resources if they're not readily available, but they don't give it a skip? I would request you to unmute yourself, Sushmi.
Yeah. Am I audible now?
Yes, please go ahead.
Yeah. Okay. So, I think, this pandemic, firstly, would play a huge role and has already played a huge role. It has brought back a lot of practices which were removed over a period of time. So, for instance, we have all once again learned to wash our hands at least when we come back home from outside, or before we sit to eat, or before we touch each other, or so all these things have some part of it the nature has taught and the pandemic has brought back, but we all have a very, very short-lived memory, and there is always this fear that as soon as the pandemic goes and everything, and we have seen a part of it after the first wave started started going away and the cases started coming down. People immediately dropped masks and all the COVID appropriate behavior had gone for a toss, and we had this huge second wave hitting us on our face. So these lessons have to be re-emphasized, have to be internalized, put in the DNA of the system once again, and that would require serious efforts from all stakeholders. That would require commercial as well as philanthropic campaigns, efforts in the form of not just movements, but also, like I earlier pointed out, it has to be internalized in education, in school education. It has to be internalized in communication as part of various CSR activities that entities do, and it has, and a lot of commercial interest can actually glamorize certain things sometimes which work for good. So that's really required. Serious kind of communication campaigns from the government, from media, social media, as well as other mediums. And apart from that, I think the doctor fraternity, which has played a very, very important role, the medical fraternity, they have a huge role to, because the messaging when comes from doctors or paramedics or people with knowledge, it makes a huge lot of difference. We have seen this in case of promoting yoga. So people, experts, opinion leaders, when this message comes from them, it makes a lot of impact and a lot of difference on ground. So I think these tools are going to play a very, very important role going forward.
Right. Professor Kumar, your concluding remarks. We've got ideas of mass campaigns, influencers, knowledgeable people, doctors, but it's just family. If I see my mom doing it, if I see my dad doing it, I'm going to learn the same thing, right?
Thanks, Anisha, and it's a pleasure to listen to Rajesh ji, Magnesh ji, Sushmi ji. Though she came in late, but really gave us a lot of wisdom on this. And Dilip ji, I look at it, there has to be a combination of the two. You have a continuous campaign or continuous practice, not campaign, where everybody in schools, colleges, universities, workplaces, panchayats is promoting hand washing. Children see adults are washing hands, they continue, they pick up that habit. And it becomes a kind of a role model behavior that washing hands is good. Then you have spikes of campaign in between. I have seen so many campaigns, especially for immunization and ORS promotion. I joined UNICEF in 80s, and that was the main thrust of UNICEF. But the campaigns don't leave a sustained behavior. It has to be a combination of both. Like you have immunization campaign, but at the same time support routine immunization. Otherwise it will collapse, and then you will be doing one campaign after the other. It will not sustain. So one is that message. Second is these tragedies like we are having now. do help us promote. But the moment the fear is gone, people go back, as happened between first wave and second wave. People have to understand COVID or no COVID, hand washing is a practice which will keep you healthy. COVID can help. And then the new, it's become fashionable to carry sanitizer now. Sanitizer should be used only when you cannot wash hands with soap and water. It is not a substitute. It is a second-rate replacement for hand washing. So that message should go out very clearly. Yes, sanitizers are good, but only to be used when you cannot wash your hands with soap and water. And my humble request, don't leave it to doctors, don't leave it to public health people. It has to be everybody's commitment, everybody's movement to promote health, and the huge dividends. I did not go into detail how many lives you will save, what proportion of diarrhea will go down, respiratory infections will go down, skin infections will go down, eye infections will go down. You have a long list of medical benefits. There a doctor and a public health person can come and tell you what you will get out of it. But the promotion is everybody's responsibility. Thank you, Anish.
Right. Mr. Pandya, your last words. We hope that along with the message of washing hands, we'll also communicate to everybody that keeping your nails clean is also important, clean and clipped. What would you like to say in conclusion?
It's a combination. It's a combination of both the things, Either you wash your hands and keep your nails dirty will not work. And either other way round will not work. So it is a combination. So I totally agree with all the panelists that washing hands is fundamental. It's very, very important. Second thing I can say that nakhun saaf to swasth rahe aap. This is our corporate logo. We wanted to teach people that your nails should be clean at least. Today we do presentation in front of people and our hands are moving, and if it is dirty, people will imagine that how clean this guy is, अब जमाना बदल रहा है. Men go to the beauty parlors. Okay, so we have to be a little bit, conscious about it and fashionable also. But at the same time, we need to understand that it's a combination, that washing hands and keeping the nails trim are one parcel. There is no separation. Second thing, before I finish my closing note, women's empowerment. Our company is having 4 mottos. One is make in India, sell in India, skill in India, and women's empowerment. Now, this women's empowerment is very important because women will go up to any extent to keep their children safe. That's for sure. This is what mother is for, So that is one thing. And second, go through children. The way we did in Surana. Today I had a school seminar also in Ahmedabad. So those kind of things, a combination of mother and son, mother and daughter will work, because mothers will be very anxious to help and keep the things intact. And children are the future asset for the country. So these are the two groups we need to educate and constantly educate them. And that's the most important thing, I would say. Thank you very much.
Thank you all for joining us today and sharing with us your experiences, your thoughts, and your advice on how we can, tackle this whole communication about the importance of hand washing. A big thank you to all of you, Dr. Sanjeev Kumar, Mr. Pandya, Shushmi, Mr. Manas, Mr. Mange. Thank you all for joining us, talking to us about your experience, about what works when it comes to communications, and how we can make hand washing a habit and not something that we may put a special effort into. A big thank you to all of you for joining us.
Thanks a lot. Bye.
Thank you.
So COVID-19 has taught us that your health is in your hands, quite literally. Stay at home, maintain social distance, wear a mask, and keep washing your hands to keep yourself safe, not just from COVID, but from many other infectious diseases. And this is something that you should do for yourself, not for anybody else, as a favor to anybody else, but for yourself. Do like and follow us on Facebook to get all the updates on our upcoming shows. Till then, stay at home, stay safe, and take care. Goodbye, and see you soon.
नोवेल कोरोना वायरस का खतरा बढ़ रहा है, तो हम क्या हाथ पे हाथ धरे बैठे रहेंगे? नहीं, हम हाथों को धोएंगे साबुन से या यूज करेंगे अल्कोहल बेस्ड हैंड रब, ताकि नोवेल कोरोना वायरस का खतरा कम हो। WHO भी यही कहता है।
डेटॉल द्वारा जनहित में जारी। डेटॉल इंडियन मेडिकल एसोसिएशन द्वारा प्रमाणित।